Okay. Well, good morning. It's 10 o'clock. It's February 11th, 2021, and I'd like to call the meeting of the Board of State and Community Corrections to order. I'd first like to welcome everybody for our first meeting of 2021, and I appreciate all of your attendance. It is a very long agenda today, so we're going to get right to it, and I'm going to ask Adam to provide instructions for participants for the meeting.
Okay.
Adam?
Thank you, Madam Chair.
Adam just freeze.
I think Adam might be frozen.
Might be frozen. Okay, since Adam's frozen, let me read Adam's remarks.
Okay, good job, Linda.
We're adaptable if we're nothing. As Adam would say, thank you, Madam Chair. Good morning, everyone. While we are using Zoom webinar platform, it will support public participation in this meeting. If you are connecting by phone, please be sure to mute your microphone or phone before dialing *6 to mute, and you dial *6 to mute and unmute. When you are called upon to speak, please eliminate any background noise before unmuting your phone. Board members, if you wish to make a comment on any agenda item, please use the raise your hand feature. Everybody see that down at the bottom of the screen? And it will raise, or physically raise your hand if that doesn't work for you. If you're calling in by phone, please speak up and be recognized during the board member comments and discussions. Today we are voting. The voting will be by roll call, and at the end of the agenda, at the end of an agenda when an item requires a vote, and Adam will, if he's unfrozen by then, will call the roll. If Adam's not unfrozen, we need somebody in the organization to figure that part out. We will give members of the public an opportunity to comment after each agenda item. After the board's discussion of all of the information items, there will be an opportunity for the public to comment on any information item. Agenda item 6 is the opportunity for any member of the public to make a comment on any item they wish to discuss. Please, if you are calling in to comment on a specific item, contain your items to that specific item. Should you want to talk about something else, we would ask you to wait until item 6. You will have 2 minutes for your comments. If you want to make public comments, please email publiccomment@bscc.ca.gov with your name and the agenda item you wish to comment on. I'm going to say that one more time. If you wish to make public comments, please email publiccomment@bscc.ca.gov with your name and the agenda item you wish to comment on. You can also use the raise your hand feature in the Zoom video. If you are calling by phone, dial *9 to raise your hand. I will call out the phone number you dialed, and then if it's your phone number, you may unmute yourself by using *6. You will be called upon to speak in the order your name or phone number was received. We will lower your hand once your name has been shared. I hope that's clear. Adam does a better job of that part. But this isn't the first time we've done this, so I'm hoping members of the public understand and can follow these instructions, even though the chair didn't do as good a job as Adam would have done. With that said,
Madam Chair, this is Katie. I'm prepared to call the roll. I don't think Adam is back.
Okay.
Adam is back.
I think
Oh,
Adam
super.
is back.
Back to you, Adam.
All right, now I will call the roll. Chair
Thank you.
Penner,
Present.
Miss Allison is absent today. Mr. Vera Rosa,
Present.
Mr. Groudon,
I'm here, thank you.
Mr. Gore,
Present.
Mr. Seal,
Present.
Ms. Zuniga,
Present.
Mr. Barranco,
Present.
Mr. Mills,
Present.
Mr. Budnick,
I'm here.
Mr. Steinhardt,
Muted. Here.
and Ms. Kumpion.
Here.
Madam Chair, we have a quorum.
Thank you. We then are going to move to my opening remarks. And once again, because this meeting is going to go very long, actually, strike that. Katie, I'm going to let you do the COVID-19 update first, because I believe you are number one on the information item.
Thank you, Madam Chair. Appreciate that. And yes, I'm going to provide an update and a state level overview of COVID-19 trends in the county jails that is taken from our COVID-19 data dashboard. I'm going to go through about 9 slides, and all of this information, including the explanatory notes, are available on the BSCC website. There's some really teeny edits that are in the slides that are going to go this morning, and this most current version will be posted immediately after the meeting. The changes are not substantive. It's just a couple of very last minute edits. So the information is available online if you'd like to take a look at that, and you'll see the notes below. I want to thank and acknowledge our research team and all of the county data reporters for the significant amount of work that goes into a data collection effort like this. And before turning to the slides, I also want to acknowledge that it is the case that sometimes there will be differences between what we have collected and reported on the COVID-19 data dashboard on the BSCC website. There may be differences in media reports. The board received a comment letter this morning with some detailed questions about differences in media reports in comparison with what we have on the data dashboard. And I want to reassure the board and the public that we do everything we can to address quality control issues in the data collection effort. Our research team has regular contact with the data reporters, many emails back and forth every week to address questions about data definitions. As I think it's really important to say that we are all working under pretty extraordinary circumstances with the global pandemic. We make every effort to provide updated, accurate information, and we do everything we can in that regard. Now, of course, there may be some differences based on what information is being counted, what information source it's coming from. But in terms of what we have here, and we'll share with you today, and it's all available within the data dashboard. These are the data that I believe have a degree of reliability for the purposes of what is happening week to week in the county jails. Yes, there may be some differences between what we have and what the media is reporting, but those could be for any number of different reasons. So I'm going to share the screen now. Please let me know with a thumbs up if you can see that. Share. Is that right? Do you have the slide, Linda? Okay, super, great. Okay, so I will
premature on his opinion.
I will try to move through this with attention to the details, but also with some efficiency because we do have a big agenda. So we wanted to start with some information about average daily population. The first several slides pertain to the adult facilities, and then the last section is on the juvenile facilities. So these first several are on the adult facilities across the state, and the average daily population, which is known as ADP for its abbreviation. As you can see, we went all the way back to the beginning of the pandemic to provide this context for you. Way back in February of 2020, the ADP was almost 73,000 across the state. And then you can see very quickly when the pandemic hit, there was a significant reduction statewide in the county population. And of course, goes without saying, there are all kinds of differences county to county. These are statewide numbers for your reference. The population was at its lowest in May of 2020 with 50,631 people in county jails. And now the current average daily population number is almost 61,000. So that's the context of how the population has changed. The next slide is going to zoom in on the period of time that this presentation will focus on, which is November through the end of January. And you can see that the population has been relatively stable over those few months. So here we start getting into the COVID-19 case trends. And as you know, or as those of you who have been tracking this as we have, the data that the BSCC collects weekly from data reporters tracks the following data elements: testing, confirmed cases, hospitalizations, deaths, and more. And there are notes in the slides about some of the counties that are not included for in these overall statewide trends. I want to just say a word about why we have two lines on this graph. As you know, the reporting protocol that we were directed on from the California Department of Public Health is that it, as part of keeping personal identifying information and health related information confidential as is appropriate, when a facility reports a number that is less than 11, in other words, a positive value between 1 and 10, that is reported as less than 11 and not the actual number, whether that's 1, 2, 3, 7, whatever it might be. And that's why we have a band showing here. When we look at the number of people in county jails who have been tested, you see a band with the low estimate being if the assumption is that number is 1 and the high estimate is if that number is 10. So I think I'm hopeful that that all makes sense. You can see that the testing overall statewide, again, the highest week of reported numbers of tests was 7,600 during the middle of December. Went up a little bit later in January, and then right now, for the most recent week of data that's available, there were 6,000 tests conducted. And then the table below shows the total number of detained people who were confirmed positive. And obviously, it's really, you know, it's very sobering to think about this. Each one of these numbers represents an actual confirmed positive case, and that's challenging for everyone. Let's see. One of the things that I wanted to point out is that there, of course, there are different testing practices within different counties and jurisdictions. So these numbers in terms of the highs and lows are pretty heavily influenced by those counties that have increased the amount of testing done in a given week. As one example, in between November 1 and January 30th, Riverside and Orange County contributed considerably to the increases and then the decreases that appear in these graphs. In the week of November 28th, Orange County reported 225 people tested, and then over 1,000 in the few following weeks. Similarly, Riverside reported 2,300 tested in the week ending November 7th, and then 530 tested in the week ending on January 9th. I'd like to give you some information about the positivity rate next. Let's see, here we are. This is the recent, the time period is the same, November through the end of January. And the positivity rate of people in county jails tracks these two orange and blue lines with the high estimate, low estimate that we covered. I'd like to explain the hospitalizations, which is a bar graph, as you can see. Again, we have these are comparatively small numbers of reports. So these are all of the instances in which a facility reported some number of hospitalizations. So if you read across the graph, I'll go to the highest bar here. The week of January the 9th, it looks like there were 9 facilities that reported some number of hospitalizations. Again, just wanting to give the board and our interested public a sense of how these trends have moved. And then we have information about testing and positivity. Wanted to provide a little bit of context about the positivity rate in the county jail facilities as compared to the general population. So these data reflect, we collected this information from other public health data sources that across the state of California, there were 23.7 million COVID-19 tests that were administered during that time period. Confirmed positive number is 2.3 million, and that's a positivity rate of 9.84%. Within the county jails, again, we have these bands of high and low, as we've already discussed, and the positivity rate at the low estimate is 5.85%, and the high estimate is 9.7%. So you can see that the general population positivity rate is fairly consistent, perhaps even a little bit higher than what is being seen within the county jail population. The next slide turns to the county juvenile facilities. And this shows the average daily population. Obviously, these numbers are much smaller compared to county jail numbers. So back in the end of February of 2020, the ADP statewide was 3,461, and it has come way down to 2,085 as of the week of January 30th. Here are the case trends in the county juvenile detention facilities. Let's see. Hold on one sec. Statewide ADP. Oh, okay, sorry. This zooms in on the time period we're talking about, which is November through now. So you see that the population has continued to drop a little bit. So here, similar to the adult data that we talked about with some other, again, the bands of the low and high estimates, the number of juveniles tested has moved up and down a little bit over time. And in the most recent week that we have the data, there were a high estimate of 639 tests and a low of 432. The confirmed positive cases is generally speaking most likely much closer to the low line than the high line, because the less than 11 data, when you impute the value of 10, that would be the highest possible. And we think it's much more accurate to assume that the numbers are closer to the lower band of the low estimate. Here are, over that same time period, the confirmed positive cases and the positivity rate. So again, with the positivity rate being somewhere between 3.24 and 21.91, but definitely closer to that lower number. That concludes the overview of the COVID-19 data in the county jails. And I also want to mention now, if I may, Madam Chair, to provide some information about the additional facility inspection and regulation related work that we have been doing in response to COVID-19. Earlier in January, our FSO inspectors requested information about what the counties are doing consistent with the regulation that's called management of a communicable disease in a custody setting. So we've asked the counties to provide us with policies, procedures, standing orders, etc. And I want to be sure that everyone is aware, again, that the responsibility within the county detention facilities for management of a communicable disease is a responsibility that's shared between the detention facility and the responsible physician, facility administrator, and county health officer. So we are making all of the efforts that we can to ensure that the regulation is that the counties are doing what they need to identify, treat, control, and manage communicable diseases. And we'll have some information on that when Chair Penner and Board Member Norma Kumpion and Allison talk about the recent visit to Riverside. So this is just a little update for the board on the data we have on COVID-19, and I'll hand it back to you, Linda.
Hey, could I ask a question? I can't find the raise my hand icon on the bottom of my computer.
That's okay.
Just to refresh my memory on the high-low issue. If it's under 11, it gets reported as under 11, right? Whether it's 3 or 9.
That's right.
If the number is 13, is that the number that gets reported then?
Yes,
So
any number greater than
actually
10.
gets reported.
Yeah, that's correct,
Thank you.
Sheriff.
Thank
You're welcome.
Okay, thank you. And as a reminder, after all of the information items, we will open to public comment. Moving on now to the chair's report, I want to do a brief discussion about some things that have occurred since our last meeting, and we will take a deeper dive into that when Allison does a presentation about our inspections. But I can tell you on January 20th, Norma Kumpion, Allison Ganter, and Michael Bush made a targeted inspection to Riverside County. And we will expand on that during the body of this agenda. But I can tell you, when we were there, we got an overview of the department's COVID-19 response, including their policies, their procedures, their screening forms, their documentation. And we reviewed their protocols, their testing procedures, and visited intake as well as medical and general population. There were discussions with individuals incarcerated. We saw programs as well, vocational and computer programming, all those sorts of things while we were there. Norma and I will further comment on that visit, if that's okay with you, Norma, during Allison's presentation. With that, we're going to take a hard look now at Katie's executive report. And we always like to hear all of the many things that she reports out on, but she will try to keep this succinct today because we do have a very long agenda.
Thank you very much, Madam Chair. The only item I wanted to provide information on for this portion is in connection with the governor's budget, which was released this year on January the 8th, and with specific reference to the BSCC budget. Most of the ongoing state grants are receiving continuing funding as we would have anticipated. That's Prop 47, Prop 64, Proud Parenting, Cal, GRIP, ARG, YRG, ARG is ongoing funding. So all of those issues did appear in the governor's budget proposal. One issue certainly of note is that the governor has proposed to sweep the unspent relinquished funds from the adult jail facility construction resources. So the lease revenue bond financing that is within of 5 different financing programs. There have been several counties that have had to relinquish their awards, and there are some minor project savings. There were minor project savings available as well. What that all boiled down to was about $202 million available for allocation, and the governor's priority is that that funding should go to address county mental health needs. So those relinquished funds are no longer available for detention facility building needs. And I think that's really all I need to update you on from the BSCC budget. Thank you, Madam Chair.
Thank you. And I'll now invite Counsel Aaron McGuire to do a legal update.
Yes, just very briefly, Madam Chair, and members of the board. I think I mentioned at the last meeting that the JAG litigation is currently under consideration by the United States Supreme Court. That those petitions are still being circulated among the court members, and it looks like may consider them under conference when they meet on February 26th, and we'll continue to watch that. NCJA, the National Criminal Justice Association, which lobbies a lot on federal JAG funding, has at least preliminarily indicated that the Biden administration looks like they will be removing the immigration conditions that were attached to the prior federal grant awards. So we expect those awards haven't been released yet, but we'll again keep you updated as those items come up. I also wanted to just flag, as per usual, about potential conflicts of interest for our board members on various grant items that are coming up for discussion today. For item C, I would recommend at this point that Chief Seal and Chief Zuniga recuse themselves. Item E, Sheriffs Gore and Groudon. For item F, again, Chief Seal and Chief Zuniga, as well as Mr. Budnick and Ms. Kumpion. And then item H, I would flag for Chief Mills, as that has to do with the extension of the CESF funding application period in Santa Cruz County has not applied yet for that. So that would be impacted there. And that would conclude my report at this time, Madam Chair.
Thank you, Aaron. And moving on now, Adam, legislative update.
Thank you, Madam Chair. You'll find the legislative update in your board materials. The legislature has until February 19th to introduce bills. It is too early for us to determine any bills that may impact the board at this time. We are keeping a close eye on it, and I'll share with you any updates in the future meetings. Madam Chair, that concludes my updates.
Okay. And now Allison, for enormous agenda item, the targeted jail inspections. And let me start by just thanking Allison for all of the incredibly heavy lifting she does for the agency, and even travels and inspects in her spare time. So kudos to you and your staff, Allison, and you may take it from here.
Thank you, Madam Chair. Appreciate that. My name is Allison Ganter. I'm the Deputy Director for the Facility Standards and Operations Division, and I'll be presenting this agenda item on the targeted jail inspections. And before I begin, I do want to thank the FSO field representatives for being out there and continuing this work. It is definitely not easy to be out and about in a pandemic. And I also want to thank our analysts for dealing with mounds and mounds of data and making it look really good. And if it hasn't been said today, we're a small but mighty group. And I continue to be grateful for the support of this now far-flung team. So thank you. So getting started, lots of screens and paper here, so this will hopefully go smoother as we go along. The enhanced inspection process, which was developed in response to the governor's directive and presented to the BSCC board in February and September of last year, is currently in process. And we informed the board in September of 2020 that the BSCC field representatives would be conducting targeted inspections early in the 2022 biennial inspection cycle, focusing on those agencies where there were multiple or serious items of non-compliance. So the 10 counties that you see on this slide that are in alphabetical order, not in order of number of violations, the counties on this slide were identified for targeted inspection in this cycle. And those in bright blue are the ones that we have conducted site visits to. It's important to note that even though these targeted inspections have been done and will continue to happen, this doesn't replace the comprehensive biennial inspection that will happen throughout this inspection cycle. And I'll provide detail on each of these counties in just a moment. But I wanted to provide a quick overview of the enhanced inspection process. Again, we're in the early stages of implementing this. And just a quick reminder, at the end of the site visit, the facility administrator will be provided with an initial inspection report outlining the outstanding items of noncompliance that the field representative identifies on site, which starts a 30-day clock where the administrator has 30 days to either correct those items of noncompliance or submit a corrective action plan outlining the time frame, typically or hopefully within 90 days, on when those items will be corrected. If we don't receive a response, if we don't receive a corrective action plan or a response that items have been corrected, we will bring those items to the board, and the board may invite the sheriff or the chief probation officer to appear before the board. I do want to just call attention to the green arrow below. What this chart doesn't show is the continuous work that the field representatives are doing. They're providing continuous technical assistance to the agencies. Each one of these steps in the process represents a great deal of ongoing work that happens behind the scenes. So I wanted to call that out, and also the fact that throughout these steps, and that's what I'll share a little bit more about today, we'll be providing regular updates to the board. So in the packet that was posted on the web last week, and that is in the board members' packets, you have a little bit more detail in those packets, but I wanted to provide a brief overview of the 5 counties where we did do site visits. And I also want to walk you through how we're thinking about providing information to the board regularly and providing updates. The data that we're sharing is for the 10 targeted inspections right now, but provides a really good snapshot of what we have and what we can manipulate as far as showing and providing updates. You can provide feedback on any other data that you'd like to see, or call out if an item is of particular interest to you. So I'll start with Madera, providing an update on the status of items of non-compliance in the facilities where the targeted inspections have occurred. So you can see here in Madera, in the 1820 inspection cycle, which is the previous inspection cycle, there were 4 items of non-compliance at the close of that inspection. We conducted our targeted inspection on January 8th of this year, and upon reinspection, they found that 2 of those 4, the field representative found that 2 of those 4 items have been corrected. And the items that you see on this table represent the 2 remaining outstanding items of non-compliance. So you can see here that their corrective action plan or correction was due to the BSCC on February 7th. On the 1st of February, a little bit early, they submitted the corrective action plan, which talked about how they've updated their policy to address the items of non-compliance. Their corrective action plan is in progress. And what's happening between the agency and the field representative right now is they are collecting documentation that will reflect compliance or non-compliance with these 2 items. Safety checks, the safety checks had been exceeding 60-minute intervals. And so every few weeks, the field representative is receiving or will go to the facility and visit and pour through those documents and ensure that the agency is meeting those time frames. So their corrective action plan is in process. We don't recommend board action at this time. And as we go through board meetings, we'll be able to see how these items progress. And then eventually, as items get resolved, they will drop off of these tables. So the next county that we visited, and we visited Modoc back in November of 2020. They had 17 items of non-compliance at the initial inspection in the 1820 cycle. When we did the targeted inspection in November, there were 3 outstanding remaining items of non-compliance. And many of the original items were related to policy and procedure, and the agency was able to correct those. The item of the number of personnel, female staff not being available on each shift, and you'll see some of those in further inspection reports. This is an issue with recruitment, hiring, and training, and may take some time beyond the 90-day time frame that we've set up in the enhanced inspection process. So it has not been resolved yet. You'll see that we received their corrective action plan before the 30 days. The field representative is, again, working with that agency, following their progress on recruitment, on policy and documentation related to safety checks and safety cells, and we'll continue to update on the progress of those items. The 2022 inspection of this county will be happening soon, so the field representative will be able to go back and follow up on this item when they conduct the comprehensive inspection. I enjoy highlighting Mono County. They had 3 items of non-compliance in the previous inspection cycle related to documentation mostly. And upon reinspection, the 2022 targeted inspection, we found that they had corrected all of their items of non-compliance. So they have no items, no outstanding items of non-compliance, and the field representative will conduct the 2022 cycle when that agency comes up. So Riverside County, and as Chair Penner mentioned, we did conduct the targeted inspection of that county just a few short weeks ago. We received their corrective action plan on the 4th of February. When they were inspected in 1820 cycle, they had 4 outstanding items of non-compliance, and now they are left with 2 outstanding items of compliance. And it's actually 1 outstanding item of non-compliance related to documentation and in 2 different facilities. So we reviewed those items during our targeted inspection. The field representative has begun to receive documentation that is showing a pattern and practice of compliance. So we will continue to keep the board updated about this item. And again, we were there to not only look at the items of non-compliance from the previous inspection cycle, but also focused on the agency's COVID-19 response in connection with the regulation for management of communicable diseases in a custody setting. And we did find that their responses were in alignment with our regulation, which does require adherence to state and federal guidelines related to the COVID-19 pandemic. And finally, the last targeted inspection that was completed was the Trinity County Sheriff's Department. They had 5 items of non-compliance. They ended up with 2 outstanding items of non-compliance in November. We've received their corrective action plan. Both of these items of non-compliance are not ones that can be fixed through policy or documentation. Again, they do need to recruit, hire, and train people to work in the detention facility. They are actively pursuing funding for new positions and working on the recruitment process. And their item of non-compliance with respect to the sobering cell will be corrected once their new jail facility is complete. And they are anticipating that that will be complete in May. So while we will track the progress of these items, it will be after some time that they will be corrected, but we will continue to keep the board updated. So that's a brief overview of the way we'll bring items of non-compliance to the board regularly, and we do appreciate any feedback that you have. What we're hoping is that you'll begin to see items drop off this list as we go further on through the enhanced inspection process. So what about the 5 counties that we haven't been to yet? I just wanted to provide some background on what's going on with those agencies. The targeted inspection for Imperial is actually scheduled for next month. The field representative has been in constant communication with that agency. Their non-compliance was related to some safety check documentation. And so the field representative has been working with the agency in seeking some technology for how to better document and for supervisors to review safety checks. That involves, referring them to other counties that have systems and helping figure out what's a better way to document those safety checks. So there has been a lot of back and forth with that county, but the inspection is happening next month. Compliance is anticipated in that agency, but we'll provide an update as well. In Los Angeles, the Sheriff's Department has confirmed update of their policies. Most of the items of non-compliance in the Los Angeles County Sheriff's Department was related to policy updates. They are involved in legal action with the Federal Department of Justice. So there are instances where their policies have been updated, but they're waiting for DOJ approval. But the BSCC field rep has confirmed that policies are aligned and in compliance with Title 15. And that targeted inspection will be completed as soon as possible. San Francisco is scheduled for next week. Again, continuous technical assistance and review of documentation. Santa Cruz, the targeted inspection is tentatively scheduled for later on in March. The Santa Cruz Sheriff's Office has actually submitted corrective action for all of the items that were out of compliance in the 1820 cycle and did send supporting evidence to verify that compliance. So the field representative will be going to ensure that those items remain in compliance. And Sutter County, we are working on scheduling that inspection. Again, continuous technical assistance has been provided to the agency to get those items in corrective action and then ultimately corrected and in compliance with Title 15. So that concludes my presentation on the targeted inspections. If there are questions or discussion from the board members, I'm happy to take any questions.
Linda, you're muted.
Apologies, my apologies.
There you go.
I'd like to invite any board members who'd like to comment on this item. And Norma, I'd like to invite you to talk a little bit about our experience in Riverside County, and I plan on doing the same. But before you and I make comments, anybody from the board like to ask questions of Allison or make any comments about our targeted jail inspection process? I'm not seeing anything there, no little hands raised or anything. Okay, Norma, if you wouldn't mind.
Yeah, thank you for that, Allison. And I wanted to start by just saying that I really appreciate the spirit of Chair Penner and Allison and Katie, and that you are even willing to go in for the inspections. I just really want to call attention to that and to just say that it's really appreciated. So when we went to Riverside a few weeks ago, I'll just speak for myself. I did find that it sounded like all of the people going into Riverside are getting tested for COVID. And that was very exciting to hear, because I think there's been a bit of a question about that. It also seemed like everyone inside knew how to get a test if they had some symptoms or if they felt ill. So that was really encouraging to hear. A couple of things though. The Riverside County staff were very hesitant about allowing me to talk to the people incarcerated. And so I am really wondering about that. I thought about it a lot, about what the hesitation was for that. And in fact, one of the staff knew that I really wanted to talk to the people incarcerated. And she said, I can, help you. Let's talk to somebody so that we could, talk to someone. And there was a big commotion about that. It was a big deal. So that, as everyone here knows, I'm formerly incarcerated. And so that is a little troubling to me. I did talk to the people inside that were incarcerated, and they all had pretty good stuff to say. They said they were able to get supplies to clean. They knew how to take a test. They knew where things were. So I'm not sure what that's about. Also, there was an issue about yard time, and the advocates in Riverside have called attention to this, saying that people aren't going outside or having their yard time. And when we asked the people inside if they had yard time, they said they hadn't seen outside in a very long time. And then Riverside Sheriff said that they were going to start that program on Monday. So that would have been like maybe the last week of January. So I'd be interested to hear if people are now able to go outside for their yard time. So that's a couple of thoughts that I have. Again, I just want to appreciate the spirit of not just Chair Penner, but also Allison and Katie and your willingness to participate in this, like boots on the ground, like go in there. We need to really rethink the way that we look at people who are incarcerated. They are part of our community. They will be coming home. The way to keep our community safer is to have resources for folks, to treat folks inside with dignity. So I will end there. If anyone has any questions, I'd be happy to talk about them, or maybe Chair Penner has something to add. So thank you very much.
I would like to add something. I was actually pleasantly surprised by our visit to Riverside. We were accompanied on the entire visit by the medical director from Riverside County. I had sort of low expectations based on the number of things we have heard repeatedly in our board meetings about what was going on in Riverside County. So I really thought I had my first reaction was surprised by the kinds of positive things that I thought were going on. I didn't notice, Norma, maybe the commotion or the angst over talking to individuals that you did, but we weren't together all the time. So I absolutely respect your response to that. What I saw and experienced was, first and foremost, is that they were testing everybody in custody as they came into custody and isolating those, and then testing. They were doing a rapid test in the beginning and then doing the longer test after they'd been there for a period of time. And anyone in custody could get a test whenever they wanted. One of the things that we were told prior to going there is that people were in lockdown 23 hours a day and only getting out an hour a day. And when we talked to individuals that were incarcerated in the pods, they basically explained to us that they were in a cohort that got to come out together for a 2-hour period of time, and then they would go back in, and then another group of individuals in that pod could come out for a 2-hour individual time. And I think it was you, Norma, who said, "Why aren't you wearing masks?" And they said to us, "Well, this is like our family. We're around these people all the time, so we don't wear the mask when we're with them, and we only get to come out of the pod with them." I thought that was as meaningful to getting people out of their individual rooms as we could expect during the time of a pandemic. And I felt like they were doing the best they could in terms of at least allowing people some time to walk around. They were doing two 2-hour blocks, and I think they were going to go up to 3 2-hour blocks in the very near future. The documentation that we saw on this targeted visit seemed to absolutely back up and support what they were verbally telling us. All in all, I walked away with a much better feeling about what was going on in the Riverside County Jail than I had prior to going. We visited the RSAT program. We looked at a computer lab. We looked at a printing lab where you may see those things in jails across the state. And they too had suffered a little bit as a result of COVID by not allowing as extensive participation in those programs as that we might wish. But there were ongoing efforts to allow a portion of the population to participate. And there were efforts to get individuals jobs who participated in those programs after they were released from custody. So while no jail is ever pleasant, incarceration is not pleasant. It is difficult to manage it without a pandemic. And I felt that the efforts they were making in Riverside at least left me with strong convictions that they were doing the best they could do during a very difficult time. And they had a very strong emphasis on the health of individuals in their custody. There was less than a 1% positivity rate the day we were there, and we all know that can change within days. So all in all, I left feeling better about Riverside than I walked in the front door when I got there. So I'd leave it at that. Allison, anything you'd like to add?
I echo, we had heard many reports coming out of Riverside, and so went in with those concerns. And I echo Chair Penner's sentiments that I walked out feeling a lot more confident in their COVID-19 response, and how open the agency was, and the people that we talked with inside the facility, how open they were with the response, and how it was going in there. It was an interesting visit, and I'm really, really grateful that we got the chance to go. I'm very grateful to the command staff at the Riverside County Sheriff's Department. They were very open with us.
Any other remarks? Any questions from the board? Anything? Sheriff Gore, did I see you raising your hand, or you just
drinking water? Thank you.
Okay. Judge Branco.
Yeah, I'm actually surprised also to hear this report. I didn't have questions before because I really wanted to hear what the three of you had to say because of what we have been hearing. And I know we're going to have a number of, I see we have a number of participants today, so maybe we're still going to be hearing more. I'm just kind of curious, Norma, when you talked about resources for folks at the end of your report, what specifically are you talking about?
Well, they have a pretty good program there. I thought about like a graphic art where they produce pamphlets and things like that. I thought that was really great. But when I talk about that, I know that sometimes those programs are limited to certain people. And so I would just like to use this opportunity to just remember that that is something that we should be focused on, and we should be thinking about at all times, is that giving people opportunity so that they have something else when they go home. It doesn't make sense to put somebody in somewhere like Riverside Jail and you sit there for, a couple of years, really not doing anything. Mm-hmm. But if you have this opportunity, like the one that they showed us with this printing program, and an ability to get a job in that field afterward, where the people there will even write you a letter of reference. That is something that I think we should all be looking for inside of our jail.
And I'm sorry, I just have one more question. I know that when we've had community people speak to us, they have said that one of the things we need to do is make surprise visits to these facilities. Did you get any feeling that what some of the things you saw were staged, or that things were relatively normal?
I wouldn't say that they were staged. We went into I guess it's a pod, they call it a pod there in jail, where everybody was pretty much like in their element. But I just think that it's definitely not. I think that they were very open about, the COVID, and I really do. I saw everything. I really do think that they are testing people. I saw that. I am just wondering about the hesitancy about letting me talk to people one-on-one. And like I said, everybody that I talked to pretty much said the same thing, that they knew where to get cleaning supplies, and that they knew how to get a test, and then they, the same as us out here, they kind of complained about the vaccine, and it was all pretty like just normal stuff, except for the not being able to program outside. They are being able to program inside the pod inside, but they weren't going outside in the fresh air. So that was an issue that I think Riverside advocates raised, and that is an issue, or it was. I don't know if that has been, the sheriff said that it would be changed on Monday, that they would start going outside, which is actually better with COVID anyway. So that has, as Katie was saying, how they operate as like, that's like their family household. So that family household, not to mix, that family household would go out in the outdoors together, which is what they would like to see happen.
Thank you.
Thank you.
All right. And anybody else on the board like to say anything about this issue? Okay. All right. I'm going to move on then to the next item, and they're really closely related. As you recall, in January, not this January, the January before, the governor made it his priority that we do these targeted jail inspections. And when we began to construct that process that you just heard Allison report out on the last agenda item, we opened it up to public listening tours to try to do a couple of things. And that was to visit some facilities and some counties that were getting less than positive reviews, and to let that public in those various counties report back to us on what they thought was meaningful with the targeted jail inspection. COVID hit, and then we began doing this online. And we had one on December 9th. And while the subject matter overview was going to be these targeted jail inspections, as you might guess, it quickly transitioned into a great deal of concerns about the pandemic, about how they were being handled in custody, and about how our board was responding to that. This Zoom meeting that we did that was really well attended, it was went on for the entire, I think 2 or 3 hours, I can't remember now. I say 3 because maybe it just felt like 3, but it was a very long meeting. And we heard from many, many people across the state about their concerns. Board members, Gordon Branco, Norma Kumpian, Dave Steinhardt, and Chief Kelly Zuniga were in attendance on that meeting, and they participated, as well as the BSCC staff. And as I said, it became really a much broader conversation than the targeted inspections. And so what we learned, that there are concerns about jails and how they were managing COVID-19, and there were a number of other understandable and legitimate problems that were demonstrated for us during that meeting. We will be able to address some of those, and we will, we don't have the authority to maybe to address the others by virtue of what the board is allowed to do. But we are paying close attention to what was said to us during that learning session. And Allison's going to highlight some of those comments that we heard for the board. And we are committed to addressing what we can and moving the agenda appropriately after that listening session. So Allison, I'm going to ask you to expand on that moment for us, and we'll ask other members in attendance to do the same after Allison finishes her presentation. And before I do that, I just want to continue to say we work very hard to be transparent and open and accountable. And I want to thank everybody because keeping all of those balls up in the air is a very heavy lift, and we're committed to that. So Allison, go ahead and take that from here.
Great. Thanks again, Madam Chair. So as Chair Penner mentioned, on December 9th, the BSCC held a listening session to hear feedback on the enhanced inspection process. 2 public sessions were held prior to this before the December session. And what our research team has done is taken all the comments we received and they've categorized them all. I hope you've had a chance to review and digest the content analysis. And we're going to provide this update now and come back to the board at a later date so that you can all reflect on the content and potential feedback. We are not done listening and responding, and we'll continue to hold such opportunities for feedback in the future. And before I begin, I want to give the biggest shout out that I could muster to Elise Ram and Casey Warmoth of our research team for the amount of thought and effort that went into this report. And again, this was posted last week, so it's available to everybody, and you have a copy in your binders, board members. Like many of the BSCC's projects, this was an add-on to regularly assigned duties, and they produced a really quality product in a short amount of time. So I'm pretty proud of our team for what they put into this report. So who commented? As Chair Penner said, there were many people in attendance. I believe there were over 100 people in attendance. 31 people provided comments, both written and verbal in the session. 82% of the participants, of the individuals that made comments, represented community-based organizations or advocacy groups. 29% of those people identified as formerly system involved. 15% of the people that provided comment were family members of people who are in detention currently or had been, and 9% indicated that they were attorneys. And this doesn't quite equal 100% because people identified in one or another category. So just so you know the context behind some of these comments. So the comments fell into 4 main categories: local facility inspections, the role of the BSCC, facility conditions during the coronavirus pandemic, and general facility conditions. And as I go further along, I'll show you how those 4 main categories were broken down into 47 separate comment groups. How we're thinking as BSCC staff, how we're thinking about responding to these comments are responses that fall into one of 3 categories. Number 1, this is a function that we're already doing, and here is how we do it. And how can we do a better job of being transparent about this function? Number 2, this is a really good idea, and the BSCC will consider the feasibility of doing this function or recommended function. And we'll continue to hear feedback on how to do that. And the third is that this comment or this function doesn't fall under BSCC authority. What we're trying to do with those comments is figure out the best way where we can direct comments and concerns about issues that might not have direct authority under the BSCC. How can we, or can the BSCC provide resources to assist people in finding answers to those questions? Or how can they submit concerns to the organizations that could handle those concerns? The first thing that we're doing is updating our website with frequently asked questions and items and issues that are frequently commented on out in detention facilities, and we're trying to provide resources for people to find how to better direct comments. So again, those 4 main categories, some of them had subcategories within them. One of the most commented on sections was the local facility inspections. And those were broken down into the inspection process itself, the inspection team, standardized procedures and regulations, and then the 4th category, general facility conditions, had 3 categories: culture, facility conditions, and health and medical care, which are the same thing. Should say health and mental health care. And in those 7 subcategories, 47 discrete categories or groups of comments were created. And I'll give you a snapshot of many of those, some of those, and a little bit of context behind them. The code book with the specific definitions for each one of those 47 groups of comments is in the attachment. However, our research team did a really phenomenal job of making them self-explanatory. I did read this many, many times, but it's my hope that when you see what the what the code is, what the group is, that you can determine what the comment is about. So again, I'm going to provide an overview of the report and a couple examples of the comments. So the first group under local facility inspections, probably the most commented group, was the inspection process. And you can see the codes or groups of comments that fell into the inspection process. And you can see that unannounced inspections was the most frequently received feedback in this category. The most common comment was that the BSCC should conduct unannounced site visits, the reason being that inspectors need to see facilities as they routinely function. So this is something that the BSCC could consider the feasibility of doing, as this is not currently a function of ours. Other frequent comments in this group included that the enhanced inspection process is insufficient, and that inspectors should be focusing on the implementation of policy, not just making sure that there is a policy. So with respect to the enhanced inspection process, and I talked a lot about that in the previous agenda item, we are early in the implementation of the enhanced inspection process. And of course, our goal is to provide greater accountability and transparency. Our team has identified several areas where we can better define or improve the process, and we're hoping to make those changes as we move through. We'll continue to seek improvements in consultation with the board on the enhanced inspection process. And again, hoping that the previous information item provided you with some background on how the enhanced inspection process is working. Talking about the implementation focus, BSCC inspectors do focus quite heavily on the implementation of policy, and how we do that is by carefully reviewing the documentation related to a policy or a practice. This is the only way that we can determine that a policy has actually been carried out, and that's through the documentation review. So could we do a better job of documenting that or demonstrating that in our inspection reports? Absolutely, and that's something that we'll be thinking more about as we go into this inspection cycle. We are also in the process of reviewing our adult minimum standards to ensure that practice, not just policy, can be reviewed for. So this is really an example of something that we are doing, that we do. It's a very strong value of ours to be able to review the documentation related to policy, but we could do a better job of documenting that in our inspection reports. A couple more comments in the local facility inspection category. Inspection team, there were comments related to having subject matter experts or other community members on inspections, having written protocols for inspections and for interviews of people housed in detention facilities, and some other codes related to regulations. Comments related to the BSCC should be enforcing regulations, and that regulation should align with national standards. We are in the process, we're coming to the tail end of our comprehensive review of all of the adult Title 15 and Title 24 regulation revisions. And one of the things that is been unique about this process is the very, very close look that we're taking to make sure that our regulations are aligned with national best practices. So the second category, the second main category, was the role of the BSCC, and you can see the four groups of comments that were collected under the role of BSCC. Leadership, we could do more to improve facility conditions. Improving data collection, that is pretty self-explanatory, and you've heard board members, community members, and BSCC staff alike talk about the desire to improve data collection. Coordinating with the new Office of Youth and Community Restoration, which is the new state agency born out of the closure of DJJ, and training other inspectors So I can tell you that we do train other inspectors quite regularly. Our team, and it's also much easier in non-pandemic times. An important role of the BSCC field representatives is to spend time with health inspectors, grand jury members, juvenile justice commissions, sitting judges that conduct inspections in local detention facilities. We participate in individual agency trainings, but we also participate in statewide conferences and trainings to train other inspectors. So this is another example of something that we are currently doing. The third category was coronavirus, and understandably, this was a much discussed topic, and you can see, again, the research team did a really amazing job of categorizing all of these comments. And while there are some of these areas in the coronavirus comments that fall outside the BSCC authority, we are committed to ensuring that the minimum standards are being met, where Title 15 requires policies and procedures related to communicable diseases, and particularly how we can ensure that federal and state guidelines related to COVID-19 are being implemented. We are in the process of reviewing all agencies' coronavirus communicable disease policies to assess this, and we will provide an update to the board when we're complete with that review. At first glance, I can tell you that at a minimum, agencies' policies and procedures, a lot of times they're standing orders or guidelines or directives on top of policies and procedures. They are responsive to current COVID-19 guidance. And we do intend to verify that practice is being followed, much like we did in Riverside when we conduct the on-site inspection. So it's a two-phased approach with those policies and procedures. We're doing the policy and procedure review, and we'll make sure that that policy is being implemented when we conduct the on-site visits. General facility conditions was the final category, and you can see where these fall. They fell into agency culture, and that's agency being the local detention facility agency. Facility conditions, lack of cleanliness, long hours in cells, and then the last being health and medical care. Most of the items are related directly to services that are provided in the local detention facility and may or may not be addressed in Title 15 or Title 24 minimum standards. And as mentioned throughout this board meeting, we do share a lot of the same concerns as people who have commented on these issues. We're going to continue to figure out the best way to direct people's concerns about these issues. And again, we're currently in the process of at a minimum updating our website. So there is a portal for people to refer to. Where these comments do refer to or align with Title 15 regulation, like cleanliness and meals, visitation programming, hygiene products for women, we can and we will ensure that such issues are not only addressed in the minimum standards, but we'll continue to ensure that they're carried out in practice during our inspections. So as mentioned, we wanted to provide this presentation to you so that we could provide you a summary of the information and allow members to reflect on the opportunities for feedback on the comments that we did receive. We will come back to the board in April with more detailed responses and options for board consideration and potential board action. I am happy to take any questions at this time.
Linda, I guess I have.
Okay, thank you, David. Go for it.
I did attend the listening session, and I thought it was amazing. There were so many good arguments and insights and some very compelling stories from members of families of people who were incarcerated, and I learned a lot. The scope of issues and complaints laid out was astonishing. Yeah, my question goes to the next steps, and I'm happy to hear, Allison, and I'm learning that the staff is going to formulate some recommendations for the board. But my question was, how do we approach the common recommendation made about unannounced inspections, which is daunting because it's hard to even do the regularly scheduled inspections now. But we do need a response in some way. I was floored by some of the comments about dirty facilities. You know, how do we enforce a standard on dirty facilities? And I keep coming back to the difference between having a policy and a minimum standard that says that the facility shall be clean, and then having dirty facilities, if that's the case, and I believe the people who said so. So maybe that's legislative work or something to make sure that there's not a disconnect between having a policy and having a result like a clean facility. So I just marked that as something that I came away with. So that's all I have to say. I thought it was a very informative session, and I look forward to figuring out what we can do about the recommendations that were made.
Thank you, David. Norma, Gordon, Kelly, all on that call. Anybody else like to make a comment?
I was also going to ask about unannounced inspections, if that's something that we can do or look into, or how that can go. I have also, after that meeting, I was thinking too, I know we have the field inspectors that go into the facilities, but I mean, would it be unheard of to have also some community members go in with them? I don't know if that's crazy talk, but I just thought I would throw it out there.
You know, I don't think anything's crazy talk. I think everything's consideration. I think we have to really be practical and pragmatic about what can be done with existing resources and what cannot be done with existing resources. And we continue to hear the conversation about unannounced inspection repeatedly, and it has not fallen upon deaf ears. And while I don't want to short set the conversation about it, I want to be clear that this listening session, these conversations, the board's attitude, recommendations, and reactions are all out there and being considered. I mean, we are in repeated conversations with the governor's office and the Department of Finance about our abilities, our authority, and what would have to change in an effort to meet some of these suggestions, comments, recommendations. So it always feels bad not to say much or not to have a good action plan right now, but we don't operate in a vacuum. And so we have to, we don't listen just because we plan on doing nothing. So I think I would suggest that what we can do, we will, and what we cannot do, we'll talk about.
Chair?
Yes.
I guess my question is very specifically, is there something right now stopping us from doing unannounced inspections? I know before I was even on BSCC, when I would tour county jails, before I even had this as part of this group, it would be like a tour coming to the second floor, tour coming to fourth floor. And obviously, we learned a lot of what was improper happening within Men's Central Jail in Los Angeles. No wonder they would say that, in case someone was getting the crap beaten out of them, or worse. So don't really know how effective at all announced inspections are going to be, because we know that every single person that runs any facility is going to clean everything up and make sure everything's in place by the time you walk through the front door. So just don't even see the purpose of what we do if it's announced, and what is stopping us from making unannounced inspections.
Well, let me address part of what you said, which means I don't see the purpose of announced visits. A great deal of what we do is done by review of policies, procedures, and paperwork before we ever get into a jail. And all of that is a portion of an inspection. If they don't have the documentation, if they can't say they're doing room checks, if they don't tell us, if they have no way of giving us evidence that that happened, then in our minds it didn't happen. So, I mean, the announced inspections play a role and must continue. With that said, I don't know that there's anything that stops us from going to a jail unannounced. I can tell you, having run a facility myself, and I think anybody on this board who has done so, you can't just people know when you arrive at a jail. They know when you're going to a particular floor. There are certainly, I guess you could hide something from us on the way in, but the other side of that is there are security concerns. There are reasons that people can't just bounce into a facility unannounced, because I mean, every one of us, me included, have to provide an ID and have a bit of a background or an obligation to go in there. So it's a mixed bag of things. I mean, I suppose, I don't know how people envision a surprise visit. We have to work out the details of that. If that's where the suggestion is, that's where we need to go. In terms of cleanliness, let me say this, Scott, I think it's hard to fake cleanliness. I think I've been in a bunch of jails. I've been in some that are, not so good, and they may have tried to fake it, but there's certain things you cannot hide. What I saw in Riverside didn't seem fake to me. It seemed clean, and we'd heard dastardly things about that. And I've been in jail over jail, and those, sheriffs or probation chiefs that run facilities, they go in with an eye on cleanliness too. And if their staff is trying to fake it, I think you could zero in on that in a minute. But we're getting a little far afield. If you don't mind, Scott, I'm going to move a little bit because I cannot take action on any of this today, except to say it's in the.
I just wanted to clarify, we don't need permission from anybody. This is just a decision we're making right now. This is a policy change we could choose to make, that a portion of our inspections are going to not be announced.
My first reaction is I'm not sure. And I think that there's a part of us that could just show up and say, we're here to do an inspection, and we'd get in. I don't see that as an enormous barrier. I think if I showed up at a jail and said, we'd like to go inside and look around, they'd let us in as the BSCC. If that's what you're asking, that can happen. Am I sure that's, how we would inspect it, what it would look like, and what would precipitate that? I don't know. We'd have to.
What I don't understand is this is our job to get a real sense of what is happening in these places where people are very invisible. And I know for a fact that there are probation chiefs and sheriffs, those on this call right now, that would not be nervous at all about someone coming unannounced and inspecting their facility, because they have pride in the facilities that they run and they know what their moral compass is. And then we hear certain sheriffs saying incredibly inhumane things publicly, and are very flippant about any accusations of what's happening in their jails. And that obviously inflames people's feelings of what might be happening in those jails, since the elected sheriff doesn't seem to care about people living or dying. You committed a crime, so just deal with the consequence of it. And so I guess the real question is, as a inspection agency, at least the part of this agency that does inspections, are we their friends, or are we the inspectors, making sure that people behind these walls, most of whom are not being sentenced to death, are being treated with humanity are living in humane conditions. I just don't see any reason why part of our inspections should not be unannounced.
Well, okay.
I haven't heard anyone on here tell
Let me
me.
say this. I don't think, first of all, I would defend our staff to the wall, that they're not going to take a relationship with a sheriff or somebody running a jail over treating people humanely. And so that's my first reaction to that. My second reaction is I don't know that anything prohibits us from walking into a jail and doing that. I don't want to give you an uninformed answer at this juncture, except to say that may be where we end up at the end of this year. There may be somebody that wants to legislate something along that lines or those sorts of things. But I don't think relationships are getting in the way of our staff in a truly meaningful inspection. There are issues with people wish we had that we do not.
My point was not our staff. That's not my point is, why don't we just make this decision?
Can others weigh in here?
Andy?
Yeah, I think one thing we have to remember is that almost all these facilities are covered with video from head to toe. And that a lot of times officers and jail deputies are wearing body-worn cameras. So unless we have a massive video editing capability, my suspicion is that we're pretty, there's a lot of evidence out there either way. And so that if we need to go back and take a look at it later, that's always a possibility. I'm not opposed to doing surprise inspections. I think that, you know, at least in our county, I have complete confidence that anybody on this video could walk into our jail and announce who we were and get an escorted view of the jail immediately. Now, I'm not saying every county is like that in the state, and I recognize your sensitivities on that, Scott, because I do hear things that concern me, you know, from some elected officials in the state. However, if there's a concern, I think that it'd be pretty easy for us to take a look at video to make sure that we're not staging, you know, what's going on in these jails. I just don't suspect that that is the case. These are large facilities that are complex, a lot of staff. It would be very difficult to stage a production like that. And I think our staff is pretty savvy. They're really thoughtful about how they do these things. They go in, they take a look at them, they ask questions. And it's that counterbalance of listening and looking for evidence and using your judgment. And so if there's a need, we can move that direction. But I guess the question I have, Chair, is there actually a need since it's already covered in video? And if we need to go back and take a look at that video to make sure it hasn't been done, that it hasn't been staged or hasn't been quick cleaned up because in a week from now the BSCC is coming, then that's a different issue for me personally.
I think you raise good points. I think Scott raises good points. I don't think we're opposed or closed to any of it. And I think we can walk into a jail right now. I don't think that's the point necessarily. I think we have to craft something that has long-range positive outcomes while we may have instances where we have to walk into a jail. So I don't think I'm close to any of that. I think video is a really excellent point and alternative for some of what we're hearing today. None of us on this board, none of us at the BSCC, and I didn't mean to say that you inferred that, Scott, but you know, I mean, there's no relationship strong enough not to do the job we're out there to do. So I think we all believe that. And I think your pressure point here is well taken. And I just want to make certain I'm not okie doking you and have a really well thought out plan to do exactly what you suggest.
I have one last thing to say, but I know Sheriff Groudon has his virtual hand raised, so.
Okay, I see you. Virtual hand.
Make it quick. So after I lower my hand, So a couple things. One thing that was highlighted in Allison's presentation is that, you know, the everyday interaction we have with our staff in our jails have with our field reps, you know, that's invaluable. You know, just that the expertise that they bring, having, you know, worked in facilities and visited, you know, a wide range of facilities. So that's where, you know, that has to be a, you know, a productive relationship between our staff and the field reps. You wouldn't want it to be adversarial, and not necessarily that it would be with an unannounced inspection. And then the primary inspection, you know, is really in depth, where they're, you know, reviewing a number of other inspection reports and other things. So the primary inspection, I don't think it would be really difficult to move that inspection away from, you know, its current format. If, you know, if there was a choice, or, you know, if my recommendation, if there was ever a move towards an unannounced inspection, that it was an additional, you know, site visit or inspection. But to do the primary inspection in that manner would be difficult.
Yeah. Oh, sorry, Chair.
I think we have to be able to review the policies, review the documentation. There's just a whole lot that requires an exchange.
Let me just end here. Sheriff Groudon, I agreed with what you had to say, and I really appreciate your leadership and having gotten to know you on this board these last few years. If I was a superintendent of a school, or a principal of a school, and I knew the superintendent was coming, I think it's a normal human interaction to make sure that I tell everyone that's in charge of cleaning that we're going to be really clean when the superintendent gets here. I'm going to make sure I go to my teachers who are a bit lazy, and make sure that they are really teaching when the superintendent's coming. And that's in a setting, and that's just normal human nature, right? I don't think any principal would not do that before the superintendent is coming. And that's in a culture where mostly everyone's there because they care about the students and want to help the students, right? We know that in this culture, with people having committed crimes, that even if your culture is great, it's still not like a school culture if we're all here to help the student. It is oftentimes with some staff and us versus them. It's a good guys versus bad guys. And when you see great culture, and I'll point out Chief Seal's facilities, like every time I've walked into his juvenile halls, I've been blown away by the quality of staff, the interactions of staff, et cetera. And that's really kind of culturally what you want to get through. But if it's the normal human interaction in a school where everyone's there to help the kids, to clean everything up before the superintendent comes, I can't imagine how much cleaning needs to be done before the BSCC comes into a correctional facility. And so I just think it's normal human interaction, and it's exacerbated in a world like this. So I agree with Sheriff Groudon that it doesn't need to be how we do our normal inspections, but it should be part of what we do. Chief Seal, I know you're raising your hand.
Thank you, Chair Budnick. I just want to say, and let the record reflect, I raised my hand before you made any comment about us up here in Sacramento. I don't want to get too prescriptive, but I do just want to simply say that I think we need to do more. And the public's asking us to do more. I think every sheriff, prison official, probation chief knows that there has to be more. It's difficult, and no matter what kind of program you run, you're always a little bit nervous when the inspectors walk in the door. But that's the right kind of healthy tension that we're big boys and girls, and that's what we get paid to do, and to manage that tension. And I think we have to take the long view that this is good for us. It's good for counties. It reduces liability. It reduces litigation. It reduces bad outcomes. And, you know, I have enormous confidence in the team, the staff we have here at BSCC, and we'll I'm sure we'll get some good proposals or feedback or come up with a good direction in the coming months to respond to some of this feedback.
Okay. Seeing no virtual hands, does anybody want to raise their actual hand before we move to public comment?
This is Katie, Linda. Can you hear
Go
me?
ahead, Katie.
Yeah, thank you. I wanted to appreciate all of the conversation and discussion that our board members have had here. We wanted to bring to you this full report with the actual input organized and analyzed from December and say, okay, board, what do you think about this and where ought we to do some immediate follow-up? And I just want to make sure that everyone on the board, as well as our interested stakeholders who are here attending as well, knows that we will come back at the next board meeting in April, having heard this input today, having heard, not surprised, but a lot of, yes, that this unannounced inspection concept is something that needs further attention. We will do some analysis of the feasibility of that. We need to operationalize these things. And I always apologize for probably what sounds like a somewhat bureaucratic response, but we need to be able to figure out how to add this into what we already do and how it fits. And some of the comments that were heard from Sheriff Groudon, about, yes, have it be part of the follow-up that you do. So we will come back to you in April with some additional concepts further developed. And I just wanted to thank the board for your conversation today.
Yeah, super meaningful. Norma, you got to unmute.
I'm just going to be really quick. I know I'm just going to be really quick, but I just wanted to say that I think that everything that we do sends a message. Everything that we do says something, just like that Allison, Katie, and Chair Penner, that you guys came boots on the ground. We've been to San Diego, we've been to Riverside. We're this, traveling band of, BSCC folks. I think that sends a message. And I think an unannounced inspection also sends a message to the people who are incarcerated, that they matter. And it would actually be something huge to say that you matter. And also to the staff, that this is so important to us, that we're changing this policy because you matter. And I'll just leave it at that.
All right. Good discussion. Great discussion. Thought-provoking. Another miniature listening session, which I think is helpful as we move forward. So thanks to everybody. Now I know I checked with Adam. We have people in the queue for public comment. I'm going to ask Adam to begin to call those names and close the queue because we have a lot going on. So Adam, do you have a list?
Yes, I have 8 people on the queue right now.
Okay.
The first one will be Brian Goldstein.
All right, and before you start, Brian, I know you're out there in Zoom world. Could we work very hard not to be repetitive? And could we try to be concise? You have 2 minutes, but we have an enormous agenda, although we have presented you with a number of things. So Brian, go ahead.
Good morning, Brian Goldstein with the Center on Juvenile and Criminal Justice. We thank BSCC staff for distributing our letter to the board and public. California's jails and juvenile facilities are facing a dual crisis: rampant outbreaks and minimal data on COVID-19. We were shocked to learn that Fresno County Jail has one of the largest COVID-19 case numbers of any correctional facility in the country. It is clear BSCC has massively underreported the situation. The New York Times and Fresno Bee found that Fresno County Jail has reported 3,985 total COVID-19 cases. But the BSCC's COVID-19 data dashboard only reports a maximum of 610 cases. The BSCC is seemingly unaware that this is even happening. Staff did not raise the issue today. This erodes our confidence in the agency's oversight and research responsibilities. We only discovered the scope of this issue because of these media reports. We also spoke directly to the Fresno Sheriff's Office last week, and they confirmed over 3,800 positive tests. While BSCC did not begin collecting data until mid-July, there is no reasonable explanation for this massive undercount. We ask that BSCC explain this massive undercounting of COVID-19, immediately revise Fresno's COVID-19 testing data, and immediately review other facility information to protect those incarcerated. Thank you.
Thank you, Brian.
Next, we have Avalon Edwards.
Hi, can you all hear me?
Yes.
Good morning, board members. My name is Avalon Edwards, and I'm a policy fellow with Starting Over Inc., based in Riverside County. I'm glad that the BSCC was finally able to inspect a Riverside facility in January, despite the fact that this inspection occurred nearly a year after 2 people who were pre-trial died of COVID in Riverside custody in April of 2020. I am grateful for Ms. Kumpion's commitment to the well-being of people inside and for her willingness to ask difficult questions and prioritize the knowledge and experiences of people in Riverside custody. I am skeptical of the reports from incarcerated people that the inspections team was able to speak with. Did the inspections team choose which of Riverside's 5 facilities were inspected, or did the Sheriff's Department? Did the inspections team have the ability to speak with incarcerated individuals in a context where they felt completely free from the fear of possible retaliation? It is entirely disingenuous to say that Riverside County is doing, quote, better than expected when the jails had weeks to prepare for this announced inspection. I'm deeply concerned that Sheriff Penner and Ms. Ganter left with, quote, a much better feeling about conditions in Riverside when this inspection was set up in the benefit of the Sheriff's Department. What does an announced inspection that does not include several in-depth, private, and safe conversations with incarcerated individuals inside and their family members outside do for incarcerated people? The purpose of these inspections is not to make you feel better. They are meant to improve the quality of life of the people that you are meant to protect. I am quite honestly scared by how easily the BSCC has been convinced by a Sheriff's Department that is infamous for lying, mental health abuses, and the dehumanization of people in their custody. It shows a clear desire to believe the narrative of the Sheriff's Department rather than the countless real stories that have been brought to this board for the past several months. In regards to the BSCC's official report on noncompliance, it is offensive to suggest that Riverside County's only item of noncompliance is related to documentation. If the job of the inspections team is to ensure that incarcerated individuals are being treated with a minimum standard of care, you have not done your job. This report of noncompliance demonstrates a failure to meaningfully prioritize the lives and well-being of the 3,800 people in Riverside County jails. 3,800 people, many of whom are being confined to their cells for over 23 hours a day, many of whom have only received 1 mask in the entire 11-month duration of this pandemic. 3 of the 5 Riverside County jails continue denying visitation rights to minors, continuing the 11-month-long separation of parents, grandparents, and siblings from their young family members. We know that some people in these facilities have only been tested once since the pandemic began. Others have had irregular access to their life-saving medications, leading to several hospitalizations and severe medical problems. Others have been denied necessary mental health treatment. Combined with near constant confinement to cells, this has led to the rapid deterioration of the mental health of countless individuals in Riverside custody. It is unclear to me.
Are you getting close to finishing?
Yes, I am.
Okay, thanks.
It is unclear to me how an inspection team managed to enter Riverside facilities and leave with the conclusion that their only issue in need of remedying has to do with documentation, when impacted individuals have been coming to this board for months, painfully detailing the human rights abuses taking place in these jails. Thank you.
Thank you.
Next, we have Captain Kevin McConnell.
Good morning, everybody. Just on behalf of San Francisco Sheriff's Department, our sheriff reached out. We're looking forward to the targeted inspection, although there will be some areas that people will not be allowed. I know this is we're going over mostly paperwork and policies, but the sheriff has stated that he does have concerns about on-site visits just during the COVID because we do limit all in-person visiting, but we have a very robust screen visiting. We've implemented mostly Zoom and Teams-based meetings for courts and everything in order to protect our population, and we're moving way forward on that. But he just wanted to let people know that he doesn't like a lot of people coming in during this COVID. That's just it. Of course, we'll be there ready for our inspection whenever they come down, and just want to thank all the advocates out there for bringing up some of these issues that should be addressed. Thank you. That's all I have.
Thank you.
Next, we have Joseph Bear.
Hi, my name is Joseph Bear, and I'm calling from the Transgender, Gender Variant, and Intersex Justice Project, or TGIJP, in San Francisco. We are calling on CDCR to massively decarcerate. The experience during the pandemic shows what was already well known before the pandemic, which is that prisons are always public health disasters and only become more catastrophic during a pandemic like what we're going through now. The 2015 outbreak of Legionnaire's disease at San Quentin shows that CDCR cannot credibly argue that they are unaware of the possibility that infectious diseases can spread quickly in their facilities. The recent OIG report once again makes clear that CDCR cannot safely house and provide medical care for those in its custodies, even under federal oversight and the direction of healthcare executives. We demand that CDCR and Governor Newsom take full accountability for their actions by granting large-scale releases to urgently decarcerate prisons across California to below 50% of current capacity, following the recommendations of public health experts. People are continuing to get sick and die from COVID in prison. No one was sentenced to death by COVID, so we implore you to immediately start to decarcerate. Thank you.
Next, we have Red Martinez.
What's good, y'all? Here to represent Riverside County, part of Riverside Justice Table. And so, bringing up the concerns about COVID-19, I was really wondering, like, we talked a lot about the inmates being tested for coronavirus, but I don't know how often, like, the sheriffs are tested for coronavirus, especially since those are the people that are in and out of the jails and are most likely the one that are, transferring the virus in the jails. So I've been wondering about that and wondering if there is a process for them to get tested every week. I know other government facilities like research science labs, they get tested every week, every 2 weeks, maybe even. So that was one of my concerns. Another one of my concerns is that we haven't released medically impaired, medically vulnerable people in Riverside County by the number that the state governor wanted them to. There was actually a specific case, Nelson Sims, who got a brain aneurysm in jail in county. He was actually sentenced for a DUI in upstate prison, even though he had multiple medical conditions and was not treated fairly. And he's serving for 3 years as a DUI, even though that's his first offense. And he's a Black man, a veteran. And, I just didn't understand that. And we're still pushing for his freedom. We're still supporting him as much as we can until he gets free. Another one that Comrade Avalon brought up is that, you decided to test the Robert Presley Detention Center. These are facilities that are pretty populated around the area, but we don't go to, areas that aren't populated, like the Southwest Detention Center, which is in Marietta, the middle of nowhere, or the Indio Prison, which is also in the middle of nowhere, which it almost seems like, if it's in the middle of nowhere, no one's gonna care and no one's gonna really check up on it. So I would really encourage y'all to check up on those.
Okay, we need you to, you're over your 2 minutes.
Okay.
Okay.
And also have surprise visits, and that would be great. Thank you.
Thank you.
Next, we have Carrie Schaaf.
Good afternoon. My name is Carrie Schaaf, and I'm a very proud mother of a son who has been housed at a variety of Riverside County jails since March 1st of 2019. My son was arrested during a major mental health crisis I was told I should be grateful because the deputy that went to arrest him went there with the intent of murdering my son that day. So I'm supposed to be happy that he's alive and in custody. He is not a criminal and he has yet to be sentenced of any crime. He's been stuck in this concrete cage and further traumatized every day because I am unable to afford his extremely high bail. He's only received one mask during this entire time of COVID, and they weren't handed out right away because of Sheriff Bianco's open opinions and personal beliefs about COVID. Not all deputies wear masks. There's multiple occasions where they're pepper spraying, which then causes a lot of coughing, germs. Masks aren't worn, and they're not provided cleaning supplies. My son's never been directed on where to get cleaning supplies. He would love to clean his own cell if he had supplies. He does not have a secondary mask, just the one. Clothing is not washed often. He said it's often once a week that they get clean clothing. When he was in India, which isn't up anymore, he said that was his worst, where there was black mold all over and actual worms coming out of the faucet. So they didn't use the water faucet in the black area because they're very segregated. And my son is black. He said there have been worms many times in his food at Banning. And speaking of nutrition, having a strong immune system is obviously very critical during COVID. And it's really hard to think about healthy and nutritious food being provided when they're getting bologna sandwiches right now at Southwest and Marietta. My son, for medical reasons, is a vegetarian, and for months, all he was provided was a slice of white bread and peas. I had maxed out $40 a week on his secure access, providing him beans and peanuts, trying to keep some sort of nutritional value in him. They overcharge us for unhealthy food options. I'm not sure why they can't provide mass or healthy food options. And I know my time is about up, but they're kept in their cells for more than 23 hours a day. I just talked to my son again this morning. He talked to prison law office about concerns, and he was definitely consequenced and kept in his cage for 2 days straight after talking to them. My son has mental health issues and has not yet received any mental health services. They provided him a crossword puzzle, and they said that is a mental health service. So whatever you'd like to do, however I can help, my son would be more than happy to meet one-on-one and talk to you, Norma or Scott. I take my hat off to both of you for speaking up. I will fight till the end, not only for my son, but for these other young men. And again, my son has not been charged with any crime, and he's being denied mental health treatment. Thank you for this opportunity to speak.
I have Michael Gerardo.
Yes, this is Michael Gerardo representing Riverside San Bernardino Participatory Defense. Being formerly incarcerated myself, I have spent most of my life in custody. Previously, I was housed in West Valley Detention Center last year. And I've noticed over the years when we're talking about public or government tours throughout our facilities, that they are staged. They only allow them, or they direct them into certain areas that they know will be very clean, very humble inmates within these areas, and they get benefits from answering the questions of these tours appropriate to make the sheriff's department look like they're doing their job. But as we see, it continues that our public and our family members that are incarcerated tells us a different story. So these are the things that we have to take in consideration. I truly believe in tours, but not advising the sheriff department. These surprise tours and going to where you desire, not where the sheriffs lead you to, would paint a different picture to what these men and women are that are incarcerated and dealing with. So as I plead with the board that we need to start thinking of broader and understanding most men and women that are housed in county jails are not found guilty yet. They're still innocent, but they're still being treated as in an inhuman way. So thank you.
And lastly, we have Courtney Morris.
My name is Courtney Morris. I'm an organizer with No Justice Under Capitalism. We've been calling on prisons, jails, and ICE detention centers to decarcerate. We need mass releases from the start of the pandemic and all of the time. It is shameful that it would even be called into question going to do jail inspections without with giving notice. Of course, inspection should only be conducted without notice. Otherwise, as everybody on the call is speaking to in public comment, they can change anything and present a situation of smoke and mirrors, as we know that they typically do, as the incarcerated community continuously points out. Linda Penner, for you to say that relationships do not take over one's duty is absolutely a falsehood. We know the penal capital that these incredibly powerful unions have. We know the financial stakeholders in this game, and to purport otherwise is unconscionable. We call on states and counties to decarcerate. Unannounced inspections are the only way to go. Otherwise, we do see things that happened in Contra Costa County, for example, a $250 million that must be applied over the next 5 years due to medical negligence in the healthcare system, where people are dying under suspicious circumstances, when jail employees are beating up mentally folks with mental health issues. The fact that from December and for months now, this has even been called into question, shows how deeply entrenched we are in our bureaucracies and how people are dying and getting sicker due to inaction. We call upon you for mass releases as the only way to prevent future deaths. No state execution by COVID-19, no county execution by COVID-19. We call on you to release folks from this racist, classist system.
Okay, thank you very much. Anything from the board? All right, moving now on to the consent agenda items. Item A is the only matter on the consent agenda, and that is requesting approval of the November 19th, 2020 board meeting minutes. Anybody?
Penner, this is Katie. I believe Gordon had his hand up.
Oh, I apologize, Gordon. I didn't see it.
No,
Sorry.
it's not a problem. And I don't, and I'm not trying to start a huge discussion, just but listening to all the community comments. Do we have, and for lack of a better term, do we have a hotline or anything like that where people can call the board and call the office and render some of the complaints that we've heard? And I'm just wondering out loud if we have anything akin to that. If we don't, the answer is no. I understand.
We do not have a hotline.
Okay, all right. Okay, thank you.
Madam
I have a
Chair,
question. Oh,
sorry, Norma.
go ahead, Scott.
Go on, Norma.
I was going to say just quickly, but is there an ombuds person that people can call at each of the facilities, and would that be located on the website? That's number one. Number two, I want to acknowledge the folks coming out here today and to thank them for coming out here and speaking to the people that are incarcerated and just staying true to their truth. And I really appreciate hearing from them today. Thank you.
Thank you. That's an omission on my part, Norma. Thank you for doing that. We as an agency do not have an ombudsman. Just to reference a few of the things that were raised, we were well aware of what was going on in Fresno. That is a question that's out there and concerning. We can only rely on the data we are provided, but that certainly raises questions. I think we rely also on media and media reports, as we exchange them daily with each other for consideration, and yet again for information to track down and see if we can make some differences as we proceed in our day-to-day duties. But we do not have that. Yet again, something we'll add to the list of things that we consider. We were, there has been a request in the past that we do something like that. Months ago, I think Katie and I heard that regarding COVID-19 on the juvenile side. So I'm going to unless there's anything else, I'm going to move
Chair
on.
Penner, I think Allison had a thought to add. I do know that our office receives many, many calls, and we have a field representative on duty for calls who can direct people to information. Allison, did you want to add to that?
No, that's exactly what I wanted to say. We do field many calls. Some of the time it doesn't have maybe a direct, we don't have direct authority to solve the issue, but we always listen, communicate, talk with individuals who are calling and try to point them in the right direction. So we do, it's not a hotline, but we have an officer of the day, or the person that calls can get to the field representative that's assigned to that county. I know I'm speaking for all the field representatives that are probably on this call, that we get a lot of calls and we take anyone that comes in, emails, phone calls, letters. We get them, we take them, we listen, we respond.
Okay. Thank you. Moving on now to the consent agenda. Anybody want to pull the minutes of the meeting for consideration? If not, Scott, I saw you light up. No? Okay. I would ask for a motion and a second on approval of the consent agenda.
Move adoption, Steinhardt.
Adam, want to take roll?
Chair Penner,
Aye.
Mr. Vera Rosa,
Aye.
Mr. Groudon,
Aye.
Mr. Gore,
Aye.
Mr. Seal, Ms. Zuniga, Mr. Barranco,
Aye.
Mr. Mills,
Aye.
Mr. Budnick,
Aye.
Mr. Steinhardt,
Aye.
Ms. Kumpion.
Aye.
Madam Chair, the motion carries.
Thank you. Once again, I'll remind members of the public, if you have not emailed public comment at bscc.ca.gov, to do that when an agenda item of interest comes up, so we can get you in the queue. We're moving now to item B, modification of the California Department of Corrections and Rehabilitation Coronavirus Emergency Supplemental Funding Grant Application. And I think we have a guest presenter here today. Do I see her?
Good afternoon, Madam Chair. This is Ricardo. Yes, we will have a guest representative as well that I will introduce.
Okay.
Before we do that, Madam Chair, Mr. Vera Rosa will be recusing himself from this item.
Okay, Guillermo, that means you leave, but don't leave too far? Do we
Yeah,
have a way
sure.
to text you and get you back?
I'm sure you'll find me and alert me when I should return. Thank you.
Thank you. All right, Ricardo.
Perfect. Thank you again, Madam Chair and board members. My name is Ricardo Goodridge with the Corrections Planning and Grants Programs Division, presenting agenda item B. Joining me today, as mentioned earlier, is Jessica Fernandez from CDCR's Division of Rehabilitative Programs to provide a project update and to address any questions that you may have. Now, this agenda item requests board approval to amend the California Department of Corrections and Rehabilitation's Coronavirus Emergency Supplemental Funding Programs Grant Agreement to allow for reentry services for people returning from state prison. Now, on July 16, 2020, the board allocated $15 million to CDCR to help address the emergency temporary housing needs of individuals released from state prison due to the coronavirus. CDCR has been providing these services, and approximately 2,200 clients have been served through December 31 of 2020. In addition to providing emergency temporary housing services, CDCR has identified opportunities to further support people returning from state prison through its Specialized Treatment for Optimized Programming Network, or STOP. Today's request would allow CDCR to continue providing housing and expand service delivery to include reentry services. Sample services might include substance use disorder treatment, detoxification services, assistance with enrollment to healthcare services, and general health education services, to name a few. Now, at this time, I will turn it over to Jessica Fernandez for a brief presentation.
Good afternoon, everybody. I'm going to go ahead and share my screen. Again, I'm Jessica Fernandez. I'm with the Division of Rehabilitative Programs from Community Reentry Services. I supervise all of the community reentry services that is funded by our division. So I'm going to go ahead and bring up my PowerPoint. Let's see. Okay. Okay, here we go. Just a minute. Okay,
awesome.
Okay, so this is, I'll be presenting data on the emergency housing services. This is the $15 million allocation that we received for the coronavirus emergency supplemental funding service, or supplemental funding. So the requirements when we were granted the funding was to provide temporary housing services to those being released because of and during the time of the coronavirus pandemic. The goal was to reduce the number of releases that were being released as a transient status or to homelessness. So the goal was to allow for a transitional period for individuals to be in housing while we coordinate services for them and see what services they're eligible to leverage and transition them into those local services. The parameters that we had were we were providing services to those that had an identified need for housing. What that translates to is that we didn't do a formalized assessment to identify any risks, any specific needs. If the probation officer or the parole agent identified an indicated need, then we would go ahead and refer them and place them into housing according to their county of last legal residence. One of our requirements was that they were released after July 1st of 2020. And another requirement was that the services did not have to be funded if they were in treatment. So it wasn't tied to substance use disorder treatment, which is our typical requirement for our funding. So what this did, it allowed us to provide housing services to individuals that we wouldn't normally have provided housing services or any type of services for. So this is just a quick overview of how the funding was distributed. This was presented previously. So we divided our $15 million allocation amongst the 6 program areas that we have for our 6 contractors. And we did so by doing a projection of the number of releases that were set to go to a program area. That program area received that specific amount of funding. An example being with program area 1, they had about a projection of 13% of the releases. So they received 13% of the overall funding. As you can see, also, they had an allocation of about 1% of the admin cost. So the admin cost that was allocated to them was to cover case management or any placement coordination, quality assurance, and bringing up new capacity. We also that administrative costs also included transportation. So in coordination, in coordinating transportation to programs, they had to also use that admin cost for that. So the projected amount that we had when we initiated the services of emergency housing, we projected about being able to serve about 6,000 individuals in emergency housing. So this is just a quick map of how our program areas work. As you can see, our top counties are considered program area 1. Our coastal counties all the way from the Bay Area down to Ventura is considered program area 2. Program area 3 is our central counties where most of our institutions are located. Program area 4 is San Bernardino and Riverside. Program Area 5, although it's one of our smallest geographical areas, it's where 30% of our releases go. It's LA County. And Program Area 6 consists of 3 counties. It's Imperial, San Diego, as well as Orange County. So here is our first quarter data. Our first quarter data, you can see that we placed 965 offenders in housing services alone. These were individuals that had an identified need for housing. And so we have bed days. So this is just a total of just different slots that were filled, I guess you could say. Our average length of stay has been on average 16 days, but I do want to let you know that we haven't, anybody who has needed a extension, we've been able to extend if the need is there. In August alone, we placed, well, let me back up. In July, we placed about 136 individuals in housing. In August, it increased to 313, but by September, in September alone, we placed 516 for a total of 965 for that first quarter. Our second quarter, our numbers significantly increased as well. We almost doubled our, we more than doubled our individuals that we served. So in the month of, in the month of October, we had, we started to see an increase, and the reason why we think we were able to increase the number of individuals that we were able to serve is because we had regular communication with probation and parole to identify where the need was, and we were targeting specific counties and bringing up capacity as we needed to. In December alone, we placed 917 offenders in emergency housing services, which was almost what the number of individuals that we placed in the first quarter alone. So here's an aggregate. So you can see for the first and the second quarter, again, the second quarter ended December 31st, and we were able to place 3,243 by the end of December. We have a little over, or a little less than 9.5 million left in funding that we're able to still serve our population in the next year or so. So with that, our proposal is to allow our individuals that are in our network to leverage other resources. So currently our capacity serves just housing, and in the housing network, we give them a clean, safe environment. They have access to food. In situations where they don't qualify for either Project Hope or even Operation Room Key, we have brought up capacity specific to quarantine individuals that are positive for COVID, who have either been exposed or are positive. We have quarantine and isolation rooms where we have single individual capacity in that specific room, and so that we could mitigate any more spread of the virus. So our proposal is on your right side, where you could see that they would have access to other wraparound services. So if there's somebody within our emergency housing that has, has either been under the influence, we would offer them an assessment, and we would be able to refer them to a higher level of service if they were in agreement. So I do want to point out that if this is approved, that it wouldn't be a requirement that they participate. We would still allow them to leverage the emergency housing services, but that would be an option that we would offer to them. That concludes my presentation, and I will go ahead and turn it back to Ricardo.
Perfect, and thank you so much for that presentation, Jessica. So, Madam Chair, at this time, staff recommends that the board modify CDCR's Coronavirus Emergency Supplemental Funding Program Grant Agreement to provide the reentry services through its specialized treatment for optimized programming network. This concludes our presentation, and we are available to take any questions at this time.
I apologize. Any questions from the board?
It's David Steinhardt. So if the funding is expanded and can be applied to this very positive list of services, my question is, does that take away funding from the initial mission, the core mission of providing housing under COVID circumstances to people who qualify for it?
No, it wouldn't. We've been able to just transition some of our, or utilize most of our resources. And so this would just be an enhancement of the services that they would be able to qualify for.
Any members of the public wishing to make a comment on this item?
Madam Chair, we have two public comments. The first one is Estela Ramirez.
Madam Chair, Scott has his hand up.
I'm going to wait till after public comment.
Okay. Estela, are you there? One more time, Estela, you're in the queue for public comment. Okay, Adam.
We have Daniela Tavak.
Hi, it's Daniela Tavaki. Hi, my first question is to Jessica. So I was just recently released from state prison, and I work for TGIJP, the legal department. I'm a legal assistant. What, for these programs, do you provide any programs for trans women and men? And what are the programs that you provide, and what are the services? And do you have any, well, first answer that, and then I'll go from there.
Did you hear all of that, Jessica? I'm sorry.
Yes, we do have services to for the transgender community. We have specific capacity in some areas, but there's capacity all over the state.
So are they able to be housed in the with the women, if they're trans women, are they allowed to live in the same houses as women, as cis women? And are the trans men allowed to live in the houses?
They are able to reside at the program with the gender where they identify with.
Okay. So so my question for you is this, so I was recently in CDCR, and I know that CDCR's response to COVID-19 has been poor, and it has, the staff don't wear masks. They didn't wear masks. They didn't social distance from each other. They didn't, they were more concerned about what their day was on the streets than actually following COVID-19 guidelines. Has that changed?
Go ahead and answer that.
I'm sorry, I can only speak to the services that are within the community after release.
Yeah, and we're getting a little far afield, and I think your 2 minutes has expired. So we're gonna be closing this down. Danielle, are you there?
Yeah. Can I say one more thing though?
Yeah, if it's quick.
Sure. So I believe that CDCR should be doing way more for inmates in prison and for our loved ones, and they should, the medical attention in Mill Creek State Prison is deplorable. My husband is incarcerated in there, and it's close to no medical attention for people that have been tested positive for COVID-19. And I think that prison handling of COVID-19 cases should be reviewed. And
Okay, and I'm going to have to ask you to bring it to an end here because we've gone on much longer. And remember, this has to actually have some sort of nexus with the actual subject matter. Sort of the open concerns and remarks need to be held until the end of the agenda when we allow you to speak on anything you like. So thank you, Daniela. And who else do we have?
I have Mary. I do not have a last name. Mary, you had your hand raised.
Yes, hi. Good afternoon. Let me first check that I got that right. If I have any concerns regarding this specific item, do I have to wait until towards the end, or could I speak on it now?
Oh, no, you're solid if you're on the agenda item we're on. That's fine.
Okay, great. Thank you. Yes, my name is Mary Moreno, and I am I have several concerns regarding, the request that is being made here today. I have concerns because I constantly hear that folks that are currently being released not only continue to struggle to receive the resources that they need to thrive once they are released, but also because they mentioned something about a program, which I believe it's called STOP, which I myself as an advocate, and I know that there might be a lot of people in here that, do not even recognize that program or haven't heard about that program or it reaching out to people once they are released, from incarceration. So my concern is if, by CDCR, requesting these funds, who will be making sure that this budget is appropriately disbursed and where it goes to, because that, that I feel is a very concern, is a very big concern, at least for me. And also, it concerns me because I don't think that there is enough releases that are happening right now for such a big budget. So, I mean, that's just some of the concerns that I would like to raise on that matter. And thank you for your time.
Thank you, Mary. Adam?
Madam Chair, that concludes the comments for agenda item B.
Okay, and I want to then go to Mr. Budnick, who's had his hands up for a very long time. Your arm's getting tired.
I just wanted to just give my huge support for this. While I recognize, Mary, your comments in terms of making sure people are aware of this funding and these services. Unfortunately, the head of parole, who's on this board, had to recuse himself from this, but I think it's a huge responsibility of parole agents to make sure they know what those resources out there are, so people, when they come home, can access those housing resources. The reason I really like this proposal, and Jessica, thank you so much for your presentation, and really thank you for everything that you personally do to assist people coming out. I think your work is tremendous, and I've watched you do it for a long time, and really appreciate your care. I love this only because we all know that housing is one of many things that folks need when they come home. And this now expands people's ability to access so many more services beyond housing while not affecting their ability to get housing as well. So I just think it's smart. I think we should do much more than the bare minimum. And I think this just does this. So I'm unbelievably supportive. And also wanted to give a thank you to Kevin Hoffman, who's in here. Kevin, I just spent the last 2.5 weeks up at Pelican Bay, and to see the programs that are starting to get restarted, met hundreds of people in college at Pelican Bay, saw healing gardens and Zen gardens in what was the Pelican Bay SHU, visited the last mile computer coding class that's still taking place up there. What's going on is great. And I think what your part of CDCR is doing, the Division of Rehabilitative Programs, both in the facility and outside the facility, is things that other states should be looking to do. We can always do better. We can always do more, and look forward to doing that. But I really want to thank both of you for doing what you do. And I'm super supportive of this funding.
Great. Any other members of the board wish to comment? Ricardo, you have a recommendation?
Yes, would you prefer that I read it again, Madam Chair? I apologize.
Well, I'm assuming people are aware of it. We're good then?
I'll make a motion.
Okay.
Dean Groden, I'll second.
We have a motion and a second. Adam?
Chair Petter,
Aye.
Mr. Vera Rosa recused. Mr. Groden,
Aye.
Mr. Gore,
Aye.
Mr. Seal, Ms. Zuniga, Mr. Barranco,
Aye.
Mr. Mills,
Aye.
Mr. Budnick,
Aye.
Mr. Steinhardt,
Aye.
and Ms. Kumpion.
Aye.
Madam Chair, the motion carries.
Thank you, Adam. Now we're on to agenda item C, Senate Bill 823, request for information.
Madam Chair, before we get back, Mr. Vera Rosa.
Well, I was hoping you were on that.
And for this item, Madam Chair, I would ask Chief Seal and Chief Zuniga to recuse themselves pursuant to Government Code Section 1091.
Gordon, can I ask a favor of you? Gordon, there's a door behind you that is an amazing glare, if you wouldn't mind closing it. There you go. That's how sensitive I am. Thank
Ooh,
you.
Nice. That's a good adjustment. Thanks, Gordon.
Thank you. Well, do we have any returnees? Guillermo?
I let Guillermo know he's on his way back.
Okay. Well, while we're waiting, I see John Prince there and ready to launch. I think we can begin.
Okay. All right, good afternoon, Madam Chair and members of the board. I'm John Prince, Deputy Director with the County Facilities Construction Division. Item C recommends that the board approve the development of a request for application for the $9.6 million Youth Programs and Facility Grant Program portion of Senate Bill 823. For background, on September 30th, 2020, Governor Newsom signed Senate Bill 823, which began the closure of the state's Division of Juvenile Justice, realigning those state functions to county governments. Under 823, DJJ will close for most youth on July 1st, 2021, and counties will then become fully responsible for housing, programming, and treatment of youth at higher offense need levels who can no longer be committed to DJJ. As part of the SB 823, $9.6 million was set aside for the Board of State and Community Corrections to award one-time grants for the counties for the purpose of providing resources for infrastructure-related needs and improvements to assist counties in the development of a local continuum of care. At the November 19th, 2020 board meeting, the board approved the formation of a working group consisting of Chair Linda Penner and BSCC board member David Steinhardt to develop and request a request for information. And I want to take this time to thank them both for your hard work and consideration during this process, as well as Casey and Stacy in the research team for pulling together all of the data and making the RFI a responsive tool. As a reminder, the working group approach was determined to be the most efficient way to collect timely information from the counties about their infrastructure needs under the tight time constraints that we had in order to get the funding out to the field as quickly as possible. The survey requested information about each county's intent to house youth after June 30th, 2021, including specific programming that they may be developing and offered for the population, whether youth from other counties will be housed in their facilities, the anticipated number of youth that will be housed, and infrastructure needs that the counties had to house these youth. Counties were asked to respond to the RFI by January 15th, 2021, and 57 of the 58 counties responded to the survey, which have been summarized in attachment 1 in your packets for your reference. We have also attached for reference a 2019 overview of the DJJ population. A moment. For youth population that can no longer be committed to DJJ, a majority of responding counties indicated that they lack capacity to serve youth in one or more of the following high needs categories within their own county that they intend to refer, and they intend to refer these youth to other counties for appropriate treatment and placement. The highest level of need for out-of-county placement were females, sex offenders, and seriously mentally ill youth. While SB 823 does not specifically include funding that's dedicated to regional hubs, about a dozen counties responding to the survey have indicated that they will or may be able to accept placement for these youth from other counties. The proposed RFA would allocate grant resources to support the infrastructure needs of counties that could provide facility and treatment space for referrals from other counties that lack this local specialized capacity. Furthermore, most counties responding to the survey indicated that they have substantial infrastructure improvement needs related to serving their locally retained population of realigned DJJ youth. Priorities noted by the counties, some of those were separation of youth by age, modified treatment space, and specialized programming. Based on the data collected, the working group proposed to develop an RFA to help address the above noted highest priority needs, the female, sexual offender, and seriously mentally ill youth. Of the $9.12 million available after the BSCC administrative costs, the proposed RFA would make available a total of $4 million for 4 projects, up to $1 million for each of the 4 projects to develop regional hubs to serve the youth referred by other counties in the 3 high needs areas that I've noted. And the intent is to award at least 1 project in each of the 3 high needs categories. The remaining $5.12 million will be distributed pro rata to all counties to support infrastructure improvement needs to serve their in-county population of realigned youth. In the event that we receive more than 4 applicants to develop regional specialized treatment programs, a criticality rating will be used to assist the working group in selecting applicants to be funded. The criticality rating will be used based on a formula designed to weigh key aspects of each proposed project using objective criteria that rely on information that will be requested through the application process. Some of the examples of the objective criteria include bed space available for out-of-county youth, number of counties for which youth will be accepted, the type or extent of specialized programming that will be available. Other pertinent criteria may be identified during the development of the RFA, and the formula for the criticality rating will be included in the RFA materials for the counties to consider. With that in mind, the staff recommends that the board delegate to the working group the development of the Youth Facilities Grant Program request for application as described and be brought back to the board for approval and release at the April 8th, 2021 board meeting with recommendations on awards to counties to be made at the June 10th, 2021 meeting. Thank you very much for time. Open for questions.
Thank you, John. Before we open it to questions, I note there are 6 individuals in the queue right now. Adam, are there any more?
Yes, we're now up to 8.
Okay, and we'll be closing the queue in the next 60 seconds. Please get in the line as needed. And I would open now for questions and comments to the board. Mr. Steinhardt?
Yeah, just a few background comments, I think, since Linda, you and I had a lot to do with bringing this sort of framework proposal to the board for further development. I mean, the background is that counties are under tremendous time pressure now because DJJ intake is going to close in 5 months. And those young people who can no longer go to DJJ come back to counties, and many will have to go to facilities that are, and counties that are scrambling to get ready for that. So this funding tries to address infrastructure and improvements. It's not programs specifically, but infrastructure and improvements that counties need primarily for those facilities and that new job under tremendous timing pressure. So we adopted this sort of working group approach to be able to do this quickly and in an informed way. And the survey that you just saw told us a lot. We really came up learning about a gap in the framework of SB 823 realignment as to regional capacity. A lot of these counties have not got a capacity to deal with certain kinds of cases, or they don't have any facility at all. So we need regional responses. And so the framework and proposal that we came up with addresses that by proposing to allocate about half of the funding to the development of regional hubs serving these high needs populations. And the rest goes out to counties to deal with realignment as they see fit. There's other funding, it's worth noting, which is a realignment block grant that helps counties adapt to this new way of doing things. That's $200 million at full impact that counties can use to house and serve this realignment population. And as we're talking about around at the 350 youth per year who are being sent to GJJ now that counties would later become responsible for. So that additional funding has to be done with a facility plan that local juvenile justice coordinating councils prepare. And so that's more work for counties to figure out how to respond. And another opportunity for those concerned about realignment and spending to work with counties on those facility plans. So this just blocks out the funding. This is not over. It was our best effort to interpret the data and meet county needs that we were able to identify with a relatively small amount of money. And there's more to come. I know there was concern from some advocates that they thought they didn't have enough input into the process. We may hear that in the comments, but I would like to say that the process remains open for input to come to us and to BSCC as we develop this RFA between now and April. And so I'll just stop there and thank you.
Thank you, David. I as your co-chair, really have very little to add, except I think there are concerns that it was slightly viewed as a closed process. That in fact was done because I think at the BSCC, we try to be nimble and accommodate the needs out there. We did this because we understood the money needed to get out quickly and expediently. And I think we all have our mind and our concerns with the youth that we're going to serve. And without this infrastructure out there as soon as possible, I think we could fail in some of these fashions. So we don't want to do that. We hope to continue to be very transparent as we develop the RFP and be open to any public comment during that period of time. Anyone else on the board wish to comment? I think we have individuals on the line that would like to do public comment now. Looking to Adam for.
Yes, we have Miguel Garcia.
Hello, can you hear me? Hi, good afternoon, Madam Chair and board members. My name is Miguel Garcia with the Anti-Recidivism Coalition. As a former youth from DJJ, I was the crew leader for the inmate ward labor program. As a young man, I oversaw treatment units remodeling ranging from the behavioral treatment programs, BTP, high core, and low core units. When each program came to an end, the differences were difficult to distinguish, as each unit was replaced with the same heavy metal appliances, walls, and doors found in the behavioral treatment program. I share my experience as the SB 823 work group that is setting up the youth programs and facilities grant program only has 2 people, and is, as you mentioned, there was lack of transparency earlier on. This falls short of the standard of BSCC work groups process in which stakeholders are selected to join the work group and meetings are open to the public. As someone who has both lived and built institutions for youth who have committed serious harm, I urge the BSCC to expand this work group to include youth with direct lived experience and familiarity and other subject matter experts in order to create a diverse body to ensure that our youth get more than facility placement, but of local continuum of care. Thank you and have a great day.
Next, we have Dominique Nam.
Good afternoon, Dominique Nam for the Children's Defense Fund, California. Acknowledging that there is time pressure that the board is working under, my major concern is still that community input was not sought, especially from those who have been incarcerated or are currently incarcerated, their family members, service providers, and others who are intimately familiar with both facility structure and the programs provided, and their effectiveness or counterproductiveness. They have invaluable insight into the needs and issues that could be addressed with the funding. Given the timeline proposed, there seems to be enough time to conduct similar collection efforts from community, and I encourage the board to do so. And I would ask that it be similarly expansive and more formal than informal mechanisms for public comment. And relatedly, inclusion of community members in the working group is critical to ensure that the RFA and evaluation of proposals aligns with the stated intent of Senate Bill 823 to implement public health approaches to support positive youth development. My last concern is the proposal of the pro rata allocation for half of the funds. Given the relatively small size of this grant compared to the over $200 million that counties will already be receiving by fiscal year 24-25, these allocations should be more targeted. Thank you.
Next, we have Renee Menard.
Good afternoon, Renee Menard with the Center on Juvenile and Criminal Justice in San Francisco, with a few points of concern regarding the administration of this grant. While the BSCC survey to probation departments was informative in some ways, it took a very narrow look at infrastructure needs, focusing only on secure facilities rather than the local continuum of care required in legislation. The BSCC has already distributed over $300 million to counties for facility construction in recent years, and that's amid massive drops in youth populations. Many of the counties interested in funding for regional placements have actually already received these funds. In comparison, this is not a large pot of funding, but it has the opportunity to do real good for youth if properly prioritized. I urge the BSCC to refrain from distributing any of these funds pro rata, potentially divvying up only $9.3 million to 58 counties. This is not an effective allocation of this one-time grant, given that counties are already receiving substantial non-competitive block grant funds, and the survey notes that only half of counties even expressed interest in this specific grant. Frankly, pro rata distribution is indecisive grant making that falls short of the BSCC's administrative responsibilities. The board approved a work group made up of only 2 people at its November meeting, despite public comment requesting that justice-involved individuals and community stakeholders be involved in the process. While Chair Penner and Mr. Steinhardt certainly have their own insights, this work group structure is insufficient. BSCC work group processes standardly include numerous stakeholders and meetings that are open to the public. Both stakeholder participation and public engagement in work group meetings are critical to this process. Goals for rapid funding distribution must be balanced by the need for effective funding decisions. If this grant is only used on facilities, this will not meet the legislative mandate for these funds to support counties in developing a continuum of care, which could include step-down options and community programs. Rather than approving the staff recommendation for this item, the BSCC must restructure its funding priorities and this work group process before proceeding with the RFA. Thank you.
Thank you.
Next, we have Karen Pank.
Good afternoon, Madam Chair and board members. My name is Karen Pank. I'm the Executive Director for the Chief Probation Officers of California. We wanted to testify today in support of the BSCC's recommendation contained in the agenda, mainly, as it's been noted here, because of the rapid timing counties are going to be asked to be ready and the relatively small amount of the funding. We do support the specific allocation for those specialized programs that were identified in the survey as being needed to be propped up as quickly as possible and would have statewide impact. I think a lot of the work done in reviewing the materials in the agenda were well done and really demonstrated that there is a much larger need, as has already been expressed here. I mean, we are definitely talking about a different level of need than we've previously seen in our facilities. And we want to be sure that we can have the facilities and the programming that are most responsive. It seems like that there is a general consensus around that. So we do note that we will want to have further discussions around that, and that the funding as you continue this process, maybe to take note of the fact that there really are still needs that are not addressed by the funding now and should be considered in these further discussions. And those are not only the facility improvements that have been noted, but also to try to provide assistance in the planning, especially those that are needed for regionalization that are beyond the need of just the specialized programs, and partnerships with counties. As noted, there are definitely counties without facilities. And so we would certainly ask that those types of things be considered in the rest of your conversations, and appreciate the time here today.
Thank you.
Next, we have Alexis Magdaleno.
Hello, good afternoon. My name is Alexis Magdaleno with Milpa, representing the area of Monterey County. I want to echo what my colleagues have been saying around the lack of transparency and the definite need for more services as opposed to more infrastructure for incarceration. I want to specifically touch on the response that Monterey County Probation gave towards this survey. You know, we have serious concerns with this. There was language that Monterey County Probation used around not having enough funds to complete their original project. The reality is that they didn't have enough funds because they're $13 million over budget, and they're a year, 2 years behind their expected completion date. And so for us, it's very concerning for them to be requesting more money to build more beds, because they already have a history of poor planning, of mismanaged funds. And the facility that we're getting is not even going to have a cafeteria or a laundry room. For us, this is concerning as community members, because ultimately we will have to foot the bill when they don't have enough money to complete this project for their high security request. We're already strapped over here in Monterey County for not having enough funds for community services. We don't have enough essential services that our community needs, but for them to be requesting more high security infrastructure is concerning and alarming. In addition to that, they also mentioned that those 33 youth are going to be coming back to their home county here in Monterey County. From what I understand, that's not entirely accurate. I think the majority of those youth will be either sent upstate to an adult institution, or they will either be released. And so for us, it's concerning that they're painting this picture that all these 33 youth are going to be coming back home, when that's not entirely true. So again, before we move fast to invest in high security infrastructure, we have to make sure that we know what we're doing here in Monterey County. Thank you.
Thank you.
Next, we have Bernie Gomez.
Yes, can you hear me?
Yes.
Okay, sorry about that. Buenas tardes, my name is Bernie Gomez. I'm with Milpa based in Monterey County. I'm here to challenge the counterproductive efforts that are setting a precedence to undermine a successful implementation for the vision of DJJ realignment. I believe there is an element of secrecy behind the survey that it was circulated to the probation departments is a derelict of duty and process. I mean, that's what I think. However, at what point were you confident enough to circumvent communication to community advocates, stakeholders, and those most impacted by the system? Don't you think community input is appropriate and necessary, especially in this situation? There is a lapse of judgment here, not just by this composition, but by the Department of Probation in Monterey County. Look, the reality is there was no guidance from you to these departments regarding what direction and thought they should submit the response with. What is evident here is if probation is left to its own device, it will expand an already large and empty facility and before it provides anything while militarizing its operations. And that's Monterey County. It's been doing it, making any efforts to bypass the spirit of SB 823. Sad to say, again, this is what I believe, and I say this because Monterey County has chosen to use misguided and dangerous language in the survey. The language and ideology by this agency in portraying what the department needs to successfully implement this new approach is absurd. The fact that thought and language such as dangerous, sophisticated, predatory, high needs, high risk population is still being utilized in response to this survey is a testament to the outdated and dangerous narrative that is used to create fear, division, and continues to dehumanize and demonize our youth rather than uplift and acknowledge the pain, the trauma they have experienced, and the urgent need to walk the path of healing and family reunification by implementing pathways to healthy, vibrant futures through a lens of compassion, love, and understanding. The truth is that there should focus on providing a robust health infrastructure through the public health and human service lens that aligns with the values of the bill and promotes community health and well-being. This board has another opportunity to show responsible leadership that is centered around doing the right thing for the people, not upholding outdated racist status quo. Will this be your legacy? Will you be an accomplice to those who seek to cling to old ideologies, policies, and practices? Or will you be a critical component to dismantle these cycles of harm, championing, breaking the cycle, building and healing family and healthy communities? Thank you.
Adam?
Chair Penner, we have 3 more left. The first one will be Red Martinez.
What's good, y'all? Red Martinez here. I spoke before representing Riverside County. I really wanted to press on like the rest of my comrades about the continuation of care and also us as a community not having a say on this work group, and that we should have had a say in this work group, even though there was a time crunch for people to get these facilities ready. We had that say in November whether we wanted more people from the community to be in this work group. But yes, also the continuation of care. There's only been talk of infrastructure, and even though high security and only talk of high security when like there also should be talk of how the infrastructure should look, whether it should be fruitful, colorful. You know, we want this to be a healthy place for youth to go to so that they can feel like they're wanted, that they're supported, that, you know, that they could heal from their crimes that they've committed. And then yet there's no also, if this is supposed to be a continuation of care, there's no talk about community funding for community-based services. You know, it's not just we have them hold for into these facilities, into these prisons, have these beds for them, and then we let them go and like, you know, try to recycle them back into the system. We need to, you know, have more methods of like resources outside for them to have help in school, for them to learn about like their history, their own history, African, Chicano history. And, you know, I don't want it to be, this bill is supposed to be focused a lot of what, you know, health-based trauma-informed services, but still what we're talking about, these high levels of security still focuses on punitive and policing methods. And that's not what this bill is supposed to do. Thank you.
Thank you.
Next, we have Cesar Lara.
Good afternoon, members of the board. Cesar Lara with Milpa out of Monterey County as well. I wanted to echo some of the comments that many of the speakers have said about the lack of community engagement in this process. And also wanted to highlight to the board, there's been a number of counties in reviewing the documentation that didn't complete the survey completely, and, you know, wanted to bring it back to the board to see what actions would be taken for those that did not give. And, you know, and lastly, we were concerned in regards to the language of the survey with some predatory language that is really contradictory to the SB 823 spirit, and understanding that we need the intent of SB 823 was a health lens, and some of the questions were not focused on that realm. And To wrap it up, we definitely have concerns around construction requests for Monterey County, understanding that your board allocated money to that county to construct a new building, a new juvenile hall, and since then, because of mismanagement, they've had to not complete it. And from a capacity of 120 beds, they went down to 80, and rewarding them with extra construction money seems contradictory to what should be done. So thank you very much.
Thank you.
Adam, you're muted.
I'm sorry. The last one is Aaron Coronado.
Hello, everyone. My name is Aram Coronado from MIPA. I'm also a resident in Monterey County. It is very crucial that BSCC starts prioritizing and starts being more transparent. The systems have failed millions of youth. We need to start doing things differently. But just like Monterey County, we have more than enough space. We have a new juvenile hall, a youth center, a new county jail, and 2 prisons right outside Salinas within less than 15-mile radius. Reality is we have an average population of 35 youth in a 114-bed facility. Monterey County is still looking at it from a very punitive lens instead of a health and healing. We need more investment in services such as prevention, intervention, while focusing on the social and emotional well-being of our youth. Our community members have not been engaged, and yet again, we have not been represented. Our youth are not just a number or a statistic. These are our children and the future of our community. Thank you.
Thank you. Back to the board.
That is all for public comments, Madam Chair.
Thank you. And back to the board for any questions, responses, anything?
Yeah, David Steinhardt wants to respond to, may I?
Yes.
Thank you. So regarding the complaint that the process was not inclusive and community voices were excluded, you know, I totally get that. I've been an advocate for years on this board for expanded community involvement, for full community representation on ESCs and other decision-making committees. So why is this one different? I participated in the modified approach based on the fact that the grant was non-competitive by statute, that it was focused on infrastructure and improvements of county level facilities based on the urgency of counties needing to respond. And I want to say people need to understand that counties are going to have to develop hard and secure capacity for DJJ level offenders coming back from the state. And if they don't, those kids are going to adult court and to state prison. And so we need secure capacity that is decently structured at the local level. And the idea that we can do this without that ignores the consequence that will arrive if we don't have decent secure capacity at the local level. And so that's part of what we were trying to do here. We were also trying to acknowledge some very important service needs for females, mentally ill youth, and those with sex offenses that needed sex offender treatment. So we tried to address that as well. So where do we go from here? I think we've blocked out a proposal that makes sense. I mean, I think it's good as a start, but I'm open to and encourage after this meeting that we create some process for further community input into what has been proposed. We're only at the RFA stage, but we do need to get moving. And so I'm going to stop there and say that, suggest that we go ahead with the understanding that we will at BSCC provide and come up with some mechanism for wider input into what's being proposed so that it can be incorporated into an RFA. And the final thing I want to say is that these battles over and questions over how communities respond to realignment need to be worked out at the local level in your juvenile justice coordinating councils, with your local board of supervisors, with the big money they're getting to adapt. So that is something, that's a process of engagement at the county and local level that everybody needs to get engaged with. So I will stop there.
Thank you, David. Anything else on the board? All right. I'm looking now for a motion and a second.
So
Dean
moved, Mrs.
Grouden.
Gordon.
And Dean Grouden will second.
All right, Adam, before you call the roll, I got a note that Mr. Budnick had to leave, so he won't be responding.
Okay. All right, Chair Penner,
Aye.
Mr. Vera Rosa,
Aye.
Mr. Grouden,
Aye.
Mr. Gore. I'm going to move on. Mr. Seal and Ms. Zuniga recused. Mr. Barranco,
Aye.
Mr. Mills,
Aye.
Mr. Steinhardt,
Aye.
and Ms. Kumpion.
Aye.
And Mr. Gore, are you still here with us?
I don't see Sheriff Gore in the,
Yeah,
in
and I
the
don't-
room, Adam.
But I did not get a note from him, but I think we just move forward.
Yes, we have 7. The motion carries, Madam Chair.
Thank you. On now to item D. Once again, if you have an interest or want to comment on this, please put your name in the queue. And I think I see Tanya here. There you are, appeared. This is the Board of State and Community Corrections Strategic Planning Extension and Timeline for 2022-2026 Strategic Plan.
Madam Chair, we're just waiting for the, for Chief Seal and Chief Zuniga to come back. There's Chief Seal. Excellent.
Back as well. There you go. I see Chief Zuniga. Okay, thank you, and we'll move forward.
So thank you. So good morning, Madam Chair and members of the board, and actually good afternoon now. I'm Tanya Parker Mashburn, Field Representative in the County Facilities Construction Division. Today, I'm presenting Agenda Item D, which requests the board to approve an extension to the current BSCC 2018 to 2020 strategic plan through December 31st of 2021, and to approve a timeline for the development of the new strategic plan that will be implemented beginning January 1st of 2022. Instead of a 3-year plan, it is proposed that the new strategic plan will be developed and implemented for 5 years, beginning in 2022 through 2026. And many of our board members are new to the board, and so they weren't involved in the strategic planning process in the past. So I will provide a high-level overview of the current strategic plan as background. For reference, the 2018 to 2020 strategic plan is included in its totality as attachment D1 of your board materials. Our strategic plan has 4 goals, which are represented on this slide that is being shared. Our goals relate to decision-making, programs, training, and technical assistance, facilities and alternatives to incarceration, and data collection and reporting. Throughout the implementation period, many accomplishments were achieved to meet the identified goals. I'll share selected accomplishments and action items in progress. We implemented listening sessions to hear public and stakeholder input and to improve collaboration. We brought recommendations to the board to expand the membership of the executive steering committees to include a broader range of stakeholders. When selecting membership for the regulation revision ESC and work groups, we ensured that there was a balance between expertise that is lived and professional. Membership includes formally system-involved people, system-involved family members, community subject matter experts, community advocates, and representatives from the local detention facilities. We developed a behavioral health training module that is available for local law enforcement to address the need for more and better mental health training. And those included lesson plans for classes such as mental health stigma and bias, trauma, emotional survival, interventions and resources, and suicide prevention. We continue to support the development and use of alternatives to incarceration through grant-funded programs such as Law Enforcement Assisted Diversion Grant, Title II Grant Program, Tribal Youth Diversion Grant, and the Youth Reinvestment Grant Program. We provided targeted assistance to grantees in the improvement of submitted local plan evaluation plans and local evaluation reports. We enhanced BSCC interactive data dashboards so that the programs and services provided in California's local correctional systems can be explored. And as directed by the board, we began work on the addition of late night release information to the jail profile survey, which is planned for implementation in July. Those are the highlighted accomplishments and action items in progress, but as you can see, several others are noted within attachment D1 of your board materials. Now we'll transition our discussion to the subsequent strategic plan. Because of the pandemic, we were not able to continue the strategic planning process in 2020. BSCC priority shift to address emergent needs, but now we're ready to pick back up where we left off. Included in your board materials as attachment D2 is the timeline for the development of a new strategic plan, which is being shared on the screen. Our proposal for the balance of this calendar year is to be designated for the strategic planning process. The timeline includes a board workshop, the engagement of and input from staff and external stakeholders and members of the public on the goals and objectives, a review of the recommendations by the board, and subsequent approval of the final 2022 to 2026 strategic plan by the board. Significant milestones that we anticipate from this timeline include the goals phase, which will entail soliciting public input on the goals via written comments in March, followed by a board workshop in March or April. Next, the objectives phase will include soliciting public input on objectives via listening session in August, and having the board review the objectives and public comments and provide input on the desired changes at the September board meeting. These activities will culminate at the November board meeting when we anticipate the board will approve the goals and objectives for 2022 to 2026. Following board approval of the goals and objectives, staff will move into the strategies phase, followed by the implementation period. Strategic planning is an iterative process. Once the goals and objectives are approved by the board, BSCC staff will regularly assess, report progress, and make recommendations to the board for adjustments as necessary throughout the process. The next course of action for the board will be to participate in a scheduled workshop, which will be a public meeting. We are proposing to convene the board in March or April. And if this is acceptable to the board, staff will outreach to the members following this meeting to identify availability for a virtual 3 to 4 hour workshop. In conclusion, staff recommends today that the board approve 1, an extension to the existing BSCC 2018 to 2020 strategic plan through December 31st, 2021. And 2, the timeline for the strategic planning process for the BSCC 2022 to 2026 strategic plan. I thank you for your time to consider this request, and I look forward to working with you throughout the upcoming strategic planning process. And now I'm happy to take any questions that you might have at this time.
Any questions of Tanya? Any comments from the board? Any public comment?
We have no public comments for this item.
Back to the board. I'm looking for a motion and a second.
Well, this is Gordon. I'll move.
And a second.
Dean Groden, I'll second.
Thank you. Adam, take roll, please.
Chair Penner,
Aye.
Mr. Villarosa,
Aye.
Mr. Groden,
Aye.
Mr. Seal,
Aye.
Ms. Zuniga, Mr. Barranco,
Aye.
Mr. Mills,
Aye.
Mr. Steinhardt,
Aye.
and Ms. Kumpion.
Aye.
Madam Chair, the motion carries.
Thank you. Moving on to item E. Do we have any recusals on this one, Aaron?
This one is for the RSAT program, which is the in custody substance use disorder. I don't know if Lassen or San Diego County has participated in this grant, but Sheriffs Grouden and Gore may want to recuse themselves if they think they may apply for this funding.
Okay, I think Sheriff Gore has left the meeting. Sheriff Grouden.
I'm chairing the committee, so.
Yeah.
Okay.
So that works out.
I won't be applying.
So you will not be applying.
That would really be wrong. Okay, so item E, Tim.
Ready to go. Good afternoon, Madam Chair and members of the board. I'm Timothy Plasek, Field Representative in the Division of Corrections Planning and Grant Programs. Today I'm presenting agenda item E, extension of the existing residential substance abuse treatment or RSAT grant agreements covering July 1, 2018 to June 30th, 2021, and approval of a new request for proposals for the cohort beginning July 1, 2021 to June 30th, 2024. I would like to thank Sheriff Groudon for his leadership as ESC chair and the ESC members for their time and effort in developing the RFP as well. This agenda item is a two-part request asking for board approval to modify the current RSET grant agreements with a no-cost 6-month grant term extension and to release a new RFP for the next cohort as recommended by the Executive Steering Committee. The RFP, the ESC membership roster, and the project summaries of current funded programs are included in your materials. As a result of COVID, the existing grantees have been unable to fully implement programs and deliver services as originally intended. Offering a no-cost 6-month grant term extension increases the likelihood that substance abuse treatment can be delivered as originally designed. Within the RFP presented today, currently funded programs are eligible to apply. If a current grantee is awarded funding, the no-cost extension would allow them to first expend remaining existing funds to avoid a funding overlap. Other key components, as you see on the slide, are a maximum cap of $500,000 per year. The eligibility is local adult jail detention facilities with only one per county allowed to apply. And then also the program requires an in-custody component as well as aftercare with the requirement for evidence-based treatment and services. With approval, the RFP will be released tomorrow, February 12th, 2021. Proposals will be due back to BSCC by April 7th. Funding recommendations will be presented to the board on June 10th, 2021. And then the anticipated start date for the projects is July 1st, 2021 of this year. For this agenda item, staff recommends the board take the following actions. 1, approve and authorize release of the RSAT RFP as recommended by the ESC and approve the no-cost 6-month grant term extensions for current grantees. This concludes my report. Happy to take any questions.
Well, thank you, Tim. I appreciate all of your hard work on this. And thank you to Sheriff Groudon, who always does what we ask. I really appreciate it. Any members of the board wish to make comments?
Sheriff Groudon.
Yeah, go ahead. Oh, your little hand is up. See, I miss that every time.
I know. I have a hard time finding it myself, but yeah, I just want to thank Tim for his work on this project and the ESC members, of course. You know, we have a great group of people who put a lot of time in putting this together. So just appreciate everybody's work. Thank you.
Thank you. Any members of the public wish to comment on this matter, Adam?
We do not have public comment for this item.
Okay, I'm back to the board looking for a motion and a second.
I'll move approval.
Thank you. Second?
I'll second it. Andy Mills.
Thank you. We have a motion and a second. Adam, please take roll.
Chair Penner,
Aye.
Mr. Verarosa,
Aye.
Mr. Groudon recused, Mr. Gord left, Mr. Seal,
Aye.
Ms. Zuniga,
Aye.
Mr. Bronco,
Aye.
Mr. Mills,
Aye.
Mr. Steinhardt,
Aye.
Ms. Kumpion.
Aye.
Madam Chair, the motion carries.
Excuse
Thank you
me,
very
Adam.
much.
And just for clarification, I did not recuse.
Right.
Oh, okay. So Mr. Groudon,
Aye. Thank you.
apologies.
All right. We're moving on now to item F, Proud Parenting Grant.
And before we begin this item, Madam Chair, I did want to just flag, this is a grant in which community-based organizations have typically directly applied for, as well as probation departments. So with that in mind, Ms. Kumpion and Chief Seal and Chief Zuniga may want to recuse themselves. And I think Scott is gone.
Well, a couple of things. Will we have a quorum?
Where are we right now?
We are
Well,
at,
I guess I should have asked my first question first. I've already asked Ms. Kumpion to chair this committee.
Oh, I'm sorry.
And then she doesn't recuse
So
herself.
Yeah, so in that case, yeah, that Ms. Kumpion can, I apologize for not seeing the chair. She can absolutely stay and vote on the measure then, because she's already disqualified.
I forgive you, but that was going to be my surprise at the end of the agenda item, and now I didn't mention it. Do we have a quorum?
yes, we now have 7.
And don't unmute Ms. Kumpion in case she wants to retract her yes. I noticed her moving her hand, so. Okay. Helene, I see you there. There you go. Present away, please.
All right, thank you. Good afternoon, Madam Chair and board members. My name is Helene Zettner, and I'm a field representative with the Corrections Planning and Grant Programs Division and program lead for the Proud Parenting Grant, and I'll be presenting agenda item F. This agenda item requests the board's approval on several actions. First, to authorize an executive steering committee, or an ESC, of subject matter experts to oversee the development of the Proud Parenting Grant Program, request for proposals, and funding recommendations process. Second, to appoint a chair to the executive steering committee. And to finally, to delegate authority to the chair to work with BSCC staff to establish an executive steering committee membership and to modify the membership if needed. So I'll take this point now that the surprise has been released to thank Ms. Kumpion for agreeing to chair this ESC membership. The Proud Parenting Program was established over 2 decades ago and was originally entitled Young Men as Fathers. And over the last 20 years, this program has evolved to serve not only young men, but also young women who have been involved with the justice systems or who may have been part of the child welfare system. The overall goal of the Proud Parenting Program is to improve and support young parents and their families by increasing parenting knowledge, positive parent-child interactions, and improve co-parenting relationships. In addition, the grant helps to provide community linkages for participants and strengthen pro-social activities. A request for individuals interested in participating on the collaborative Proud Parenting ESC process will be established through our website with the approval of this body. The ESC will oversee the application process, read and rate the eligible proposals, establish data measures and outcomes, and subsequently make recommendations for the grant awards to this board based on results of the proposal evaluation process. The current cohort of grantees have begun their 3rd and final year, completing their projects this December 31st, 2021. Therefore, to provide a seamless funding stream to the field, the item before you includes a tentative timeline with the proposed activities for funding a new round of grantees to begin as of January 1st, 2022. So again, to remind you, staff is recommending the board authorize an executive steering committee of subject matter experts to oversee the development of the Proud Parenting Grant Program request for proposals and funding recommendation process, to appoint a chair to the executive steering committee, and to delegate authority to the chair to work with BSCC staff to establish an ESC membership and to modify membership if needed. I want to thank you for your time, and I'm happy to answer any questions.
Thank you, Helene. Any members of the board have any questions or comment? And we really will take you off mute, Norma. I didn't mean that part about, you know. No, none there. Any public comment, Adam?
We have no public comment for this item.
Thank you. I'm looking for a motion in a second, please.
Dean Groudon make a
I'll
motion.
move.
Okay, I have a motion and a second, I believe. We'll go with Gordon as I'm sorry, Sheriff Groudon as the first and Judge Branco as the second. Adam, please take roll.
Chair Penner?
Aye.
Mr. Vera Rosa?
Aye.
Mr. Groudon?
Aye.
Mr. Seal? Recused. Ms. Zuniga recused. Mr. Barranco?
Aye.
Mr. Mills?
Aye.
Mr. Steinhardt?
Aye.
And Ms. Kumpion?
Aye.
Madam Chair, the motion carries.
Thank you very much. Moving on to item G, the jail profile survey and late night releases. I see Casey Warmoth there, ready to present on this item. Casey?
Good afternoon, Madam Chair and members of the board. Item G requests approval to collect data related to late night releases from jail and the AB 109 survey data through the jail profile survey. In February 2020, the board approved a staff recommendation to add the collection of information about late night releases from jail to the jail profile survey after consultation with reporting jurisdictions and subject matter experts to ensure the new information can be collected. Following board approval, BSCC staff developed a draft recommendation for the collection of information related to late night releases. The draft recommendation was provided in attachment 3 and took into consideration existing California law, California recent legislative efforts, legislative changes in other states, and the concerns associated with late night releases. Staff solicited input regarding this draft recommendation in a virtual listening session through written comments and from data reporters during a quarterly conference call. No substantive comments related to the draft recommendation were received during the virtual listening session. 2 written comments were received. 1 comment was submitted by a data reporter for a small county who opposed the addition of late night release information because of the additional data collection burden and concerned that the data may be used to target agencies for a lawsuit. 25 data reporters representing 22 counties participated in December's quarterly conference call. During the meeting, no data reporter mentioned being opposed to the addition, and the conversation focused on defining the individuals to be included in the counts provided and the importance of knowing county policy information to accurately interpret the data and data availability. Additionally, counties were surveyed to gather information about data availability. Based on responses from 37 counties, most counties will be able to provide the data, although some system updates or manual processes may be required. 16% of the responding counties indicated that the data will not be available and the county will report a U for unavailable. After considering the input received, the data availability information, no modifications to the draft recommendation were made. For the collection of late night release information, the recommendation adds a new section to the monthly jail profile survey form and collects the number of individuals released during the month between 6 a.m. and 5 p.m., between 5 p.m. and 11 p.m., and between 11 p.m. and before 6 a.m. It also defines the term release. This item also requests the approval to integrate the AB 109 jail survey into the jail profile survey. The AB 109 survey was developed in 2012, and at the time, information technology resources were not available to integrate this into the jail profile survey as intended. Incorporating that survey into the jail profile survey will provide efficiencies not only for BSCC staff, but also for those who provide the data. Regarding a timeline for the project, staff anticipate updating the jail profile system by the end of April 2021, providing data reporter training in May of 2021, and going live with data collection in July of 2021. As data for the jail profile survey is screened and posted quarterly, the new data would be made publicly available by January 1, 2022. Staff recommends that the board, 1, approve the addition of late night release information to the monthly jail profile survey as described in attachment 3, and the collection of policy and practice information from each county. 2, approve the incorporation of the AB 109 survey into the monthly jail profile survey. And 3, approve the timeline for implementation. This concludes the presentation, and I'm happy to answer any questions.
Thank you, Casey. Back to the board. Any questions or response? Seeing none. Adam, is there public comment?
We do not have public comment on this item.
Okay. Casey, thank you for all your hard work on this. I know when you get late in the meeting, you know that you almost feel like you have to rush, but we know you didn't rush doing this. So thank you so much for that.
Thank you.
All right. Looking for a motion in a second.
I'll move it.
Thank you. Second.
I'll second.
Got that. Adam, take roll, please.
Chair Penner,
Aye.
Mr. Villarosa,
Aye.
Mr. Groudon. Okay. Mr. Seal. Ms. Zuniga.
Aye.
Mr. Barranco.
Aye.
Mr. Mills.
Aye.
Mr. Steinhardt,
Aye.
Ms. Kumbion,
Aye.
Mr. Groudon, is he voting, Aaron? He should be.
I don't know.
I believe that Sheriff Groudon recused since this
Okay.
on this item.
Okay.
Madam Chair, the motion carries.
Thank you very much. Moving on to item H. The Coronavirus Emergency Supplemental Funding Program request for applications, extension of application deadline. Looking,
And I'm going to recommend on this one that Chief Mills recuse himself. Santa Cruz County didn't submit an application quite yet.
I'll recuse. Thank you.
okay.
Madam Chair, and I'll do my best to be brief, looking at the timing as well. So again, everyone, my name is Ricardo Goodridge with the Corrections Planning and Grants Programs Division, presenting agenda item H. And this is a request to the board to extend the CESF program application due date to March 12, 2021, to allow eligible counties additional time to apply for funding. Now, at the September 2020 board meeting, the board authorized staff to develop an RFA for approximately $41.7 million. It was subsequently released on November the 20th with proposals due back on February the 1st of 2021. 24 applications were received by the due date, requesting approximately $33 million of the $41.7 million that was available. 33 counties did not respond to the request for applications. At this time, it's unclear why a larger number of counties did not apply. As with prior funding opportunities, information about the grant was shared through our electronic listserv and as well as through our county partners. But that said, to allow interested applicants additional time to apply for funding, staff proposes extended the application due date to March 12th. During this time, we will reissue a notice of funding availability that encourages applications from the 33 counties that did not submit prior. Should significant funding remain after this due date, staff will bring a funding recommendation to the April 9, 2020 board meeting for further discussion. At this time, staff recommends that the board extend the Coronavirus Emergency Supplemental Funding Program application due date to March 12, 2021 to allow eligible counties additional time to apply for funding. And Madam Chair, this concludes my presentation.
Thank you, Ricardo. Looking to the board for any questions or comments. Seeing none, Adam, do we have any public comment?
Yes, I have one public comment, and that would be Avalon Edwards.
Hi, can you all hear me?
Yes.
Hello again, board members. This is Avalon Edwards of Starting Over Inc., a wraparound reentry services provider in Riverside County. I've emailed BSCC officials with the following questions and have not yet received a response, so I'm sharing them with you now. Recently, the Riverside County Sheriff's Department requested permission from the Riverside Board of Supervisors to apply for $3.3 million in CESF funding through the BSCC. This application raised several questions from both community members and supervisors, primarily because our Sheriff's Department is uniquely unfit to provide reentry services to the same people they are currently caging. Are all county agencies eligible to apply for this funding from the BSCC? If so, how did the BSCC make all county agencies, not just law enforcement agencies, aware of this funding opportunity? Why did the Riverside County Sheriff's Department know to apply for this funding while departments like the Department of Housing, Homelessness, and Workforce Solutions did not? It is very concerning that CESF funding specific to reentry service provision may be granted to a department that does not provide reentry services when there are several county agencies with much smaller budgets that could use this funding to implement meaningful reentry programs. If the deadline for applying is extended, may another Riverside County agency compete with the Sheriff's Department to be the lead agency for handling this reentry funding? Additionally, the Coronavirus Local Advisory Group established by the Sheriff's Department for deciding where this funding will go is composed of 4 individuals, 3 of whom, conveniently, are active members of law enforcement. Community members are very skeptical of this group's ability to responsibly designate this funding towards reentry services when up to 80% of this funding could go to things like equipment, overtime pay, and training for the Sheriff's Department, not reentry services. The composition of this group clearly evades the intention of having CESF funding committees with representatives from counties, municipalities, tribal governments, and CBOs. If Riverside County can't apply for this funding through another lead agency, such as Housing, Homelessness, and Workforce Solutions, please advise how concerned community members may request a change in the composition of this funding advisory group. Thank you.
Thank you. Back to the board. Any questions, comments? Seeing none, may I have a motion and a second, please?
Oh, wait. Is there, I mean, what Avalon was saying is, I know today we're just voting on moving it to March, right? So maybe we'll have an update like in April about some of the concerns that Avalon brought today.
Madam Chair, I can respond a little bit on that. I was aware of the questions that Avalon had submitted, and I do believe that we sent a response, Avalon, to Avalon at starting over. There may be a problem in the email, and I truly apologize for that. It was our intention to get this answer back to you on Tuesday. We provided notice out of this CESF emergency funding for counties to all county administrative officers, as well as county probation chiefs. The focus that the board had determined as a priority was related to re-entry. So that was what went into the consideration about how the county should receive notice. The CAOs certainly had the opportunity to share that as broadly and widely within their county government as they may have wanted to. And then in terms of the local advisory committee membership, it is in the RFP that at a minimum, the local CESF advisory committee should include representatives from non-governmental community-based organizations, tribes, and cities within the counties that are impacted by the proposal. So we can follow up with you separately, but that's in specific response to your inquiry.
Thank you, Katie. If I could just respond really quickly. I didn't receive your response. I just checked. So if you could resend.
Yeah, absolutely. And I'm sorry about that. Yeah.
No worries. And then if the primary question being, can another agency apply competitively for this funding, seeing as community members do not see the Sheriff's Department to be the correct agency to be administering reentry funding in Riverside County?
I think we should hold on the answer to that. I don't think that certainly is a concern, and you've registered that. But I would really ask that we don't publicly go into that conversation. Avalon, I think it's fair for you to call Katie or to continue the conversation on email. Is that suitable?
Yes.
Okay.
Thank you, Madam Chair.
Okay. Moving on now. Motion and a second, please.
This is Gordon. I'll move.
Okay, second.
I'll second.
Thank you. Adam, please take roll.
Chair Penner?
Aye.
Mr. Groudon?
Aye.
Mr. Villarosa?
Aye.
Mr. Seal?
Aye.
Ms. Zuniga?
Aye.
Mr. Bronco?
Aye.
Mr. Mills recused. Mr. Steinhardt?
Aye.
And Ms. Kumpion.
Aye.
Madam Chair, the motion carries.
Thank you. I know these are difficult conversations, and I don't mean to shut people off, but I think it's important to, have some of these conversations in a different venue rather than, dictate the terms over this meeting. Thank you. Moving on now. We've finished the formal portion of this agenda, and I would now invite public comments to be in the queue. We will be closing the queue in 60 seconds. And Adam, how many people do we have currently?
We currently have 7 in the queue.
Thank you.
And as just a point of information, Mr. Steinhardt did have to leave for another meeting. Just wanted the board to know.
Thank you. Adam?
All right. First, Miguel Garcia.
Hi, Adam. I believe my my comment was already addressed on another item, so I'll pass on.
Okay.
Thank you, Miguel. Next.
We have Brian Goldstein next.
Good afternoon, Brian Goldstein with the Center on Juvenile Criminal Justice.
we reiterate our concern that BSCC has missed an ongoing crisis at Fresno County Jail. Again, this is one of the largest COVID-19 case numbers of any correctional facility in the country. The New York Times and Fresno Sheriff's Office report over 3,800 total COVID-19 cases. BSCC only reports a maximum of 610 positive tests. These are more than just cases. These are people. We ask that BSCC immediately address this issue. Thank you.
Thank you.
Next, we have Renee Menard.
Hello again, Renee Menard with the Center on Juvenile and Criminal Justice in San Francisco. I had intended to speak during the information items, but unfortunately wasn't able to go through. So this is in relation to the listening session. I want to greatly appreciate all the community members that shared their lived experiences with the BSCC in December and recognize that these insights are really critical to improving the process of inspecting jails and juvenile facilities. In particular, community members focused on declining conditions during COVID-19. And it's worth acknowledging here that the BSCC has not issued guidelines to counties since the start of the pandemic 10 months ago. Additionally, many community members spoke about horrific conditions and neglect in jails such as Riverside County, which notably was not seen during the BSCC's last visit. I echo others' concerns that this inspection was scheduled, providing forewarning to facility administration, as we've heard time and again being an issue, and want to reiterate that conversations with incarcerated individuals that are within sight or earshot of correctional staff are limited, since incarcerated individuals report facing a very real fear of retaliation. There was strong recommendations for unannounced inspections and the need for BSCC to institute an accountability system within its current powers. Comments also brought to light abusive staff acting with impunity, accompanied by a general lack of accountability and the BSCC's lack of will to do so. To remedy these issues, the BSCC should consider setting restrictions of consideration for BSCC grant funding for counties that do not remedy items of noncompliance. Additionally, the BSCC could better monitor media reporting that find harmful facility conditions and take additional action to ensure the safety of people inside dangerous facilities. I asked the BSCC to address community concerns with a substantially revised inspections process and to solicit feedback from community members before seeking approval from the board. Thank you.
Thank you.
Next, we have Melissa Jackson. Melissa Jackson, are you there?
Okay, go ahead, Adam.
All right, we have Henry Ortiz. Ooh.
Okay.
And we have Alexis Magdaleno. And last, we have Aaron Coronado. One more time.
All right. Thank you. Thank you to all the board members. I know it was a 3.5-hour meeting with 0 breaks. I appreciate all your hard work, and we'll see you on April 8th, 2021 for our next meeting. And until then, stay healthy.
Same to you. Thank you.
Bye-bye.
Thank you, Madam Chair.